Good morning, everyone. Welcome to the special call meeting for the Newton County Board of Education for a discussion and update on reopening school for fiscal year 2021. I'd like to call the meeting to order at 8:45 a.m. Just to let everyone know, this morning we had a board member that had an emergency, so we had to get him logged on since he could not be with us physically. So it had nothing to do with technical difficulties before everybody starts. But we have Mr. Johnson, who we're grateful to be here by way of technology. So we'll get started. Ms. Fury.
Thank you, Madam Chair. Good morning, everybody, and thank you for being here as we revisit our reopening plan to better understand our current state of affairs and how that relates to our plan. Just to give context to people who are watching, because I think everybody in this room knows me, I've lived in our community for 30 years. I'm just beginning my 21st year in our school system, and this year also marks my 28th year in education. It's so hard to believe that it's been 28 years, but it has been. Over my years, I have encountered unique situations, but I can assure you, nothing quite as strange and challenging as what we have faced over the last 5 months. It's important to note that my motivation as the superintendent and educational leader of our school system is to do the very best that I can on behalf of our students and their families while ensuring the health and safety of our students and staff. My number one priority will be and always will be the safety and health and well-being of our students and staff, because in the absence of that, the learning just can't take place. So, as you know, the COVID-19 landscape is evolving, and over the last several weeks and months, the guidance from our partner agencies has changed and updated rapidly and frequently as new information has become available. Interestingly enough, the agencies providing our information and our guidance to return to school are continuing to work from home, and they are teleworking, and some don't have plans to return for the foreseeable future. So, to get started looking at the data, in July, as our plans were developed for reopening our school system and presented to the board for your feedback and support, it's important to note that the team worked diligently during the months of, really since we've closed, trying to predict and foresee what might it looked like when we returned to school. But specifically during the month of June, lots and lots of activity took place to ensure a viable, flexible plan that's responsive to the environment and conditions. And during the month of June, while we were working, we saw an average daily case rate of 8.9. And from June 1st through June 30th, our COVID positive cases increased by 250, which is not a small number for sure. During the presentation of our plan, and multiple times since then, I have cautioned that our plan could change given the conditions of our community and review of the data. Our plan is actually tied to the level of community spread and depends upon where we fall and what would warrant a transition to a more closely aligned model. The month of July has presented a new challenge. The average daily case rate in the month of July was 29.8, which is a significant increase from 8.9. The increase in positive cases was 903, almost a 361% increase compared to June. I spend time monitoring our community conditions. I participate in health department partner calls. I collaborate with colleagues from all across the state, because while this feels unique to Newton County, almost every single superintendent, if not every single one, across the state of Georgia, and all boards just like you, are struggling with these very important decisions. So I communicate with them to see if anybody has the silver bullet. And unfortunately, at this stage of the game, there is not a silver bullet. I talk regularly to Dr. Arona, our Gwinnett Newton Rockdale Health Department Director, to discuss plans, my thoughts, share my ideas, seek her guidance, and her recommendations. It is important to note that the Department of Public Health, specifically our Newton Health Department, has been a partner with our school system for not just this particular incident with our COVID-19 cases, but also when considering communicable diseases and transmission rates of those diseases in our community. Specifically, when we have cases of the flu, we send to the health department daily attendance rates. They monitor those numbers to look to see about things like the flu or strep throat or, in one case, the norovirus. And they have historically used that data to recommend to us to close school so that deep cleanings can take place and we can protect the health and safety not only of our students and staff, but their families and the surrounding communities, especially with highly transferable and high transmission-related diseases like the norovirus. And you all might recall we had to close Oak Hill at one point because of the norovirus. But interestingly enough, given all the data that's available now, everyone is struggling to give us an answer about what is transmission and how does that play out into our school system. Trying to come up with the numbers and the transmission rates that they use to guide us with other communicable diseases has been a challenge. And the candor that we are accustomed to experiencing from the Gwinnett Newton Rockdale Health Department is not quite the same. From Dr. Arona, I hear things like, you can safely open school. And that really points to my team and whether or not we can put things in place to mitigate for and control for the coronavirus. But I'd like to kind of twist that question and ask the question a little differently. Not can I safely open schools or you can safely open schools, but instead, is it safe to open school? I have heard from teachers reluctant to return to our buildings, staff members who are struggling with lab-confirmed COVID cases. I heard of another student just this morning. Those who are excluded from work, I've heard from them because they are contacts. I have seen a principal deal with his or her COVID diagnosis and the fallout from that, and teachers throughout the district who have faced positive COVID results, one as recent as yesterday. Recently, we've had a football player and cheerleaders also experience the impact of the virus. I've also heard from teachers who are looking forward to getting back to normal and getting into the classrooms, but they have expressed that they want to be assured that we're doing everything that we can to ensure their safety. And for the record, I'm so proud of our teachers. I'm proud of our leaders and our staff. We have an amazing group of people. To be where we are today, under the conditions that we are all facing, is nothing short of remarkable. And I don't know that we say that enough to our people, so when I have the opportunity to do so, and I mean all of our staff, our school nutrition people, our bus drivers, our custodial team, and our central office staff, everyone is working hard to do the right thing for everybody. And unfortunately, it's a challenge to do the right thing for everybody. I've heard from Dr. Burks, who serves on the Federal Coronavirus Task Force under the direction of Vice President Mike Pence, say that communities experience a positivity rate of more than 5% should move to distance learning, and as recent as Sunday, August the 2nd, 2020. And our rate is more than 2 times the recommended 5%. Recently, Georgia received notice to submit a new plan for public health measures to control COVID-19 spread. Additionally, the report pointed out that the risk of transmission in school is really going to be influenced by what's going on in the community, the community transmission. Meanwhile, Georgia recently became the 5th state to eclipse the 200,000 confirmed cases milestone. While this information represents Georgia and not Newton County, it's important to our school system because 38% of our workforce comes from outside of our community. And we know that this virus knows no boundaries and isn't selective about who it attacks. Finally, I recognize how politically charged this issue is, and sadly, in some cases, politics might be outweighing the scientific evidence of what's going on in our county, state, and nation. Rest assured, I have no political motivation none, zero, zilch, zip, to make any decision about my school system, my staff, my families, my community. My personal opinion, which I've received notification from people that my personal opinion needs to stay out of the decision-making. Rest assured, I have never made a decision about our school system based on my personal opinion. It plays no part in my decision-making or my recommendations. I am simply doing my level best to make the very best decisions from the very worst options. There is nothing like students learning in the presence of a teacher. Nothing can replace that experience. Not a virtual situation, not a packet, nothing can replace the experience of being in a classroom with a teacher. But my charge from you as board members and from our community is to balance the best case scenario, the number one thing for our kids learning in person, with the number one priority of our district, ensuring the safety, the health, the well-being of our students and staff. And with that being said, the changes in our indicators, I felt that it was prudent to revisit our plan in order to make any necessary adjustments. And finally, I do want to say, and I'm going to continue to say this, if we want to be back to normal, to be in person, full steam ahead, everybody in our community, because it's not about what's happening in the state necessarily. I'm focused on what's happening in our community. Everybody has to help us. And to help, you have to wash your hands, watch your distance, and wear a mask all of the time. Whenever you are in settings that are not in your own household, wash your hands, wear your mask, and watch your distance, the 3 W's. With that being said, Dr. Barr, I'm going to turn it over to you for the actual slide presentation.
Okay, thank you, Ms. Fury. So what we've prepared for you today, just to provide you with an overview of what we're going to be looking at. We're going to take a quick look at our guiding principles for planning, our strategic improvement plan, what does our strategy map say, just a brief look at our core beliefs, a review of the instructional models as we discussed them in our first meeting about the recovery and reopening plan, indicators of COVID-19 transmission in the community, our response to illness protocols and some numbers associated with that, a little information about workforce readiness, and then a review of our teaching and learning supports and student supports. So just as a reminder, the guiding principle, yes, ma'am?
I'm sorry, I was just, the people who are viewing this can't hear you.
Okay.
Is your mic on?
They said they can barely make out what you're saying.
Okay.
You might have to slide the mic closer.
Okay.
Yeah, Dr. Barr, you are soft-spoken. You're a little low tone there.
Get real close to that mic.
Slide it
I
over.
think it's the mask.
Can
You got to
Mr.
keep it on.
And while we're adjusting, Mr. Johnson, I want to make sure you can see it too. Mr. Johnson, can you see it as well?
That microphone is so much better than the one you have right there.
You want to switch?
I may have to.
I
All right,
need-
what about now? Is that better?
You
It's
sound
much
better.
louder here, but
Okay. All right, so let's move to taking a look at the guiding principles for planning. And those are safety-focused, responsible, practicable, and adjustable. Our strategic improvement plan, you may recall our strategy map, and here are positive and supportive environment. And so with that, we'll transition to a review of the instructional models and some information about those. In option 1, the traditional selected a virtual option, and 34 selected the traditional model. This is the same slide that we used when we talked about Likewise, this information on this slide was included in the written report. And so as you can see, the last bullet point says under,
Dr. Barr, hold on one second.
Okay.
We lost sound.
Yeah,
Okay.
every,
Every time you go to a screen, they lose the audio.
Huh.
Yeah, we got it, we fixed it.
okay,
We need to,
Do we need to back up?
back up, yeah.
at least to the percentages, I think. that
Yeah.
was
Yeah.
part of it.
And it's 66, right?
Yeah.
56 according to that, right?
Yeah,
56, yes.
Okay.
All right. Okay, this is where we're starting from? So,
Is that not equal 100?
It doesn't, 'cause
no,
there's
it
still some-
doesn't. There's some that we've not been able to get in contact.
Okay, so that's why my calculation, I was like.
About 10% or 11% that we have not been able to get in
Okay,
contact with.
if, you might want to say that part, because I'm sitting here like, oh,
Okay.
that's the wrong calculation.
All right. Everybody
Okay.
ready?
Yeah, I think everybody is good now. It's back, yeah, they said it's back now. Okay.
All right, so we were taking a look at the instructional models and the percentage of students that had selected those models. So in option 1, the traditional in-person instructional model, 34% of students selected that. Option 2, the school-based virtual model, 45% of students selected that option, and then in the self-paced virtual academy, 11%. And so, which is a total of 56% selecting a virtual model, and 10% of our students we're still working through to try to contact those and have been unable to do so thus far. All right, and this is the same slide that I shared with everyone the last time we met to discuss the recovery and reopening plan. And there are 2 bullet points on this slide, and the first just says that students attend school in person and on campus 5 days a week. This is the traditional model, what you think school looks like all the time anyway. The second note is in red. The traditional model is offered contingent upon levels of community transmission of COVID-19 as determined by the Georgia Department of Public Health. In the next slide, this is directly from the written report of the reopening and recovery plan. And as you can see, number 3 is in red, and it says under when there is substantial level of community transmission that students will attend school remotely. And so everything that we have been working on, all of our health and safety measures, the physical distancing, the health screenings, the PPE, and healthy hygiene practices, cleaning, sanitizing, and disinfecting, all those things have been based on a situation in which kids would report to school and there would be low to no community spread or minimal to moderate community spread. That's what we've been working to accommodate. And as I previously mentioned, students will learn virtually when there is substantial community spread. So that takes us to indicators of COVID-19 community spread. And what we've tried to do is bring together 5 indicators for you to take a look at, so that we're not just focused on one thing. So the 14-day case rate. And so this is provided by the Georgia Department of Public Health. And so you can see the week ending 7/27, 360 cases per 100,000, and the week ending 8/3, 330 cases per 100,000. And by the Georgia Department of Public Health's own definition, that is a high rate of transmission, the highest rate of transmission. This is provided by the Harvard Public Health Institute, which also classifies Newton County as a red risk level. And so per 100, that's cases, daily new cases, that's 28.4 per 100,000 people. And a red risk level means that we should have shelter-in-place orders as necessary. Or, excuse me, that's not, let me state that correctly. That shelter-in-place orders are necessary. That's what red risk level means, according to the Harvard Global Health Institute. The next indicator, number 3, is rate of positivity, and this is what Ms. Fury previously noted. This is the number of positive cases in Newton County, and as you can see, it's twice the recommendation. The recommendation is 5%, that you have shelter-in-place protocols at 5%, and we are at 10%. Anything above 5% should have shelter-in-place protocols, and we are at 10%, and that's from the World Health Organization. Indicator number 4 is total cases. And you can see when we met in July or so, it was around 700. And now total cases is around almost 1,700. Hospitalizations, which is a really true indicator because that's just the number of people that are hospitalized for COVID-19. When we met in July, that number was around 94. And it is currently 193. So in summary, taking a look at those 5 indicators, the 14-day case rate categorized as high by the Georgia Department of Public Health, daily new cases, risk level red, and that's by the Harvard Institute of Public Health. The rate of positivity is 10.1. What you would be looking for is 5% there, not to have shelter-in-place orders. Total cases is increasing, and there's the number it's increased to, and hospitalizations are increasing, and there's the number for that. The CDC advises in a document entitled Preparing for a Safe Return to School, which was updated August 1, 2020, that it is critical to make decisions that take into account the level of community transmission. These 5 indicators provide us with data needed to make informed decisions relative to the level of transmission in the community, and trends for each of these indicators support the transition to virtual learning for those students participating in the traditional in-person instructional model. And of course, we would continue to monitor this and look for positive indications in any of those 5 indicators. So what's all that mean to us internally? We've got a relatively small number of staff members that are working now. We certainly have not brought back teachers, and we don't have students in the building, but we can take a look at what we've dealt with the number of staff and students that are presently in buildings. So we've established a review team to manage incident reporting, to serve as a liaison between supervisors and health officials, and to establish needed protocols and processes to respond appropriately to the pandemic. And so here's some numbers I want to share with you. 10% of our employees currently working have been impacted since July 13th, 2020. 8% of our students participating in athletic activities have been impacted since July 13th. The COVID-19 review team is currently spending about 15 to 18 hours per day investigating reports, working with the local health department, and providing notifications to employees and supervisors. Total primary cases for employees, and what's a primary case? A primary case is you've tested positive for COVID-19, you have symptoms of COVID-19, or you've been in direct contact with someone with COVID-19. So we've had 43 primary cases. And so we make an effort to notify anyone who meets the standard of a contact, and that's a secondary case. So we've had 11 of those. We have 26 employees that have returned to work, and we have 17 that are currently quarantined, and we've had 9 positive cases. And this is all since July 13th. In terms of students, we've had 25 primary cases, 32 secondary contacts, Total currently quarantined, total students currently quarantined is 25. And as Ms. Fury mentioned, I updated the slide this morning to total positive cases 2. In terms of workforce readiness, 20%.
Dr. Barr?
Yes, ma'am.
Can you go back to that
Yes,
slide
ma'am.
one more time for me?
Mhm.
And I got a quick question before I forget on this slide. Let me turn to the mic so people can hear me, but then it's behind me. So 26 return to work, 17 quarantine, and
9 positive cases.
9 positive cases. That's out of the 43 or out of the?
No, that's out of all employees.
That's out of
working
all
right now.
employees.
Yes, ma'am. Mhm.
Okay. Okay, thank you.
Yes, ma'am. In terms of workforce readiness, 20% of our employees have indicated that they are unable to return to work due to COVID-19 related circumstances and would be covered under the Families First Coronavirus Response Act, which expires December 31st. So with all of that and and a desire to move to virtual learning for those students who are participating in the traditional in-person learning model, we just wanted to review a few of the teaching and learning supports. The first one is that we have our Canvas system. The board recently approved Edgenuity. We are asking for board approval for Zoom video conferencing on Tuesday night for the expanded version of that. We've got numerous instructional learning tools available. We will have technology device checkout. And I think since in recent months, we've purchased about $1.6 million in additional technology devices. And I think Tuesday night is that additional devices on Tuesday nights? Yeah, so we've been in the process of acquiring additional technology. In addition to that, we've got the YouTube channel and technology help desk to support our students and staff. A review of some student supports. 24/7 access to social emotional supports. Our school counselors are available to all folks virtually, as are our social workers, our APEX clinicians. We have Purposities to support our students and families. Youth mental health first aid and No Place for Hate continues even in the virtual setting. Our school nutrition program and our transportation department are working together to develop a plan to deliver meals to as many students as possible in a door-to-door model so that we can keep folks working and deliver meals to students. We've established an online free reduced meal application process to make sure students have access to that. And of course, we continue to offer My Payments Plus so that families can pay for meals to be delivered to their home. And that would be at the same cost that the normal meal is. And so in this presentation, we've looked at the guiding principles for planning, strategic improvement plan, our strategy map, our core beliefs. We've reviewed the instructional models. We've looked at the indicators of COVID-19 community spread, our response to illnesses, our workforce readiness, a review of teaching and learning supports, and a review of student supports. And that concludes the presentation.
Thank you, Dr. Barr.
Yes, ma'am.
Okay, I'll open the floor for questions of the presentation. Any questions? Looks like Mr. Johnson may have one. We can hear you now, Mr. Johnson.
I'm sorry?
We can hear you. Did you have a question?
No, thank you.
Okay. Any questions, discussion? Okay, Ms. Coggin?
Mr. Barr, you said that we have a plan for reaching out to take meals to the students, and they can sign up for free and reduced lunches, things of that nature. Where are we getting the money to pay for that? I know in the spring we did the same sort of thing because people had already signed up for free and reduced lunch. But the federal government, from what I understood, gave us we received a grant to pay for that, and to help cover the cost of the food nutrition workers. Where is that coming from for this? And what happens to the kids whose parents may not sign up for the free and reduced lunches? How are we going to guarantee that all our students get that lunch during the day?
Okay, so the first question as it relates to money is it's still a USDA reimbursable meal. So we would, for every meal served, we would receive a reimbursement.
Okay.
And so that's how the program is funded. The second part of the question is that I have a vision. I don't know that I don't know. This is what I'm hopeful will happen. I would like to have the ability to deliver a meal to every bus stop in Newton County, and so that students would be able to come out to those bus stops and pick up their meal and have that available for them. That's what we're working on right now.
Great idea. Another question, just to sort of, so we're all thinking through this. If the kids are doing work virtually and they're required to be online for 6 hours, basically, how are they going to the bus stop to pick up their lunch?
And so we've had conversations with our friends over in with the Chief Academic Officer Division to make sure that we are accommodating for some time in there that folks are able to obtain their meal.
Okay, but in doing that, I mean, not all buses are going to be able to drop off at the exact same time.
That's right. I would say there's some challenges in it, and it may be a little messy on the front end, but certainly I think it's something that we can work with.
It's a logistics issue. I mean,
yeah,
I get it.
that's
I
right.
get it.
I know in Gwinnett, because Gwinnett did this last spring when we closed. They had some buses that did the morning bus route. So as we use the app for those people that have students that do ride buses, that gave a time when your child's bus was going to arrive. I mean, I could think about the fact that if you use that app to say the bus will be here at this time, it gives the students a time. The app did, Trey and I did identify problems we had with the app because both of our students ride buses. But the app was cleared up and it got better, and the time is pretty much on the money with the time. So I know in Gwinnett they did morning and then some did lunch. The virtual students do have a built-in lunch as the schedule is right now on the schedule. It's a lunch time frame built into the actual schedule.
It is, and we will, of course, are going to have to tweak that according to what Dr. Barr just said. There will be some unintended consequences, and so we will work through those challenges as they come up. We try to plan as best we can, and I'm going to use this word again. We have a vision of what we think it ought to look like, but then when we start actually getting into actually executing the vision, then that's when we run into the challenges. And then, of course, as they come up, then
You'll
we will
tweak it.
work with the transportation department to maybe modify our
But
time.
utilizing that app should assist with that. I mean, because the app is wonderful, really. I mean, it says your bus will arrive at 7:55 a.m. and literally the bus pulls up at 7:55 a.m. So,
Okay, I've got a few more questions, I think. You mentioned, well, to go back to that, just something else we need to think about in providing the lunches for those that choose virtual. Parents are going to be at work. I know, Ms. Fury, you said that the some of the agencies you've been working with are telecommuting, don't plan. The state is fixing to open up. I've got that this morning. They are not going to allow the agencies to continue to telework. So just for your knowledge, that this will be happening in the near future. What they were planning on doing was waiting for schools to open. But, they got to draw a line in the sand, so to speak, and get back to work. So we are going to have students who are home alone. With the buses and different times, me as a parent personally, I don't want my middle schooler to walk down the street to go get lunch in the middle of the day without me being home. And if I'm at work, basically what I'm saying is it probably needs to happen the night before in the mornings when parents are at home. And children don't need to be going to the bus stop at different times during the day, especially if they're supposed to be online with their teachers. If you've got a teacher that's teaching English from 9 to 10, but my neighborhood over here, the buses come in to drop off my lunch at, 8:45, and then another student over here, the bus is coming at, closer to 10. It's just not going to work, I don't think, logistic-wise during the school hours.
Cobb County Cobb County School District also did a partnership with USDA, and so they have a meal kit that you can pick up for the whole week.
Right, and that's one of the options that we're looking
Yeah.
at, is delivering more meals at one time.
Right, exactly. Let's see. You mentioned in Zoom, the platform, and I know it comes up to us on Tuesday, but just for, the purposes of you mentioning it, where is that money coming from to pay for the additional platforms for technology and virtual support?
General funds? Yes. We have put it in the general funds budget for FY '21, and so it is projected to come out of the FY '21 general budget if approved, yes.
Okay, so, but still in order to do that, would we have to go into our reserves?
No,
So it will just take the place of something else that's already been budgeted?
that is correct.
Okay. Talking along technology lines, Ms. Fury knows that we've got a very difficult issue at my house. We have internet. When I answered the survey as a parent about access to internet and the support, do we have the computers, et cetera, I answered yes, because we do. However, what we learned with the virtual learning in the spring is that our internet, the only one available in our area, does not support more than one person being online at one time, if you're streaming or if you're participating in a Zoom. My husband, for instance, works in Rockdale County, and he's being required to work at home. And so, because he pays the majority of our bills, of course, he's going to have to be online. So therefore, my two students cannot be online at the same time. So they can't participate in the virtual if you're expecting them to do it during, be online from, 9 to 3 or 9 to 2 or whatnot. They just physically can't because we don't have the infrastructure. Another thing is, I said that we have computers. Well, I've got one and I have to be at work with mine. My husband will be working on one, and then we have one other computer. So even though I said, we don't need computers, in reality, if they have to be online at the same time, we will. So, and what worries me is that, we purchased enough hotspots to help, but I've brought hotspots to my house before. They don't work. There is something, I don't know if it's just sitting over my end of the neighborhood. But so basically, what are we going to do for those students? Because in my imagination, if we go virtual, it would be for a week or two, but they would be getting in person, majority of the time. So if they could do a week or two, and we would make it work. But when you're saying that they're going to be graded, because this past spring we did not grade them. If they did not make, if they made below a certain thing, they weren't counted. So, but moving forward, we have to count grades. So you're going to tell my kids that you have to be virtual, but we are not providing the support for them to be virtual and to do their best, and then you're going to grade them, but they're not getting taught, so to speak. So what are we doing as a school system to provide the extra needed support for these situations?
Okay. Great questions. So if I could just take them in part.
That's fine.
One, we do have enough devices based on those who have requested them, and if approved, to have our school system start off virtually. We do believe that we will have enough devices for families or individual students that need them. And so that should cover the actual Chromebook device, as well as the hotspots. We do have hotspots, devices that are available, one supported by AT&T. We do have hotspots supported by Verizon. So if a family is experiencing any type of concerns based on the hotspot that they have, they certainly can reach out to our technology department and see if they have the right company-supported hotspot, because it may just be, changing out that hotspot. And then based on the question you said with your own family, and Dr. Fayal, our technology director, is here, so please correct me or jump in if you would like. But I've been in consultation with him far as it relates to multiple people being able to get on the internet at one time. If you share that concern with us, we have the capability in the district to increase the data. So that should allow multiple users to access the internet all at one time. So, again, we do have those hotspots that are available. If anyone's having concerns, reach out to your school tech or to our technology department so we can help troubleshoot and see if it is just the device that's provided by that internet provider, and then a possibility to increase the data plan so that multiple people can use the hotspot at one time.
Dr. Thomas, before you go to the
ma'am.
answer her next one, let me interrupt. And because I know last semester, some staff thought they didn't have access to it. And so I wanted to say that's available to staff as well.
That is correct.
So just wanted to make sure that that was clear, because some of our teachers was thinking, oh, I saw it being offered for the students, but I need one too. So staff is available to you as well.
Yes. So we are asking for any parent to make that request at the individual school. So if you're a parent and you have more than one child in our school district, please make your request for a device or hotspot at each individual school, as well as for the staff that will need access to the device or the hotspot.
Okay, I know, for instance, we had a person who actually asked for a hotspot and extra technology help last spring and was turned down because their kids were in elementary school and basically middle and high school were given top priority. So in that regards, do we have enough available to provide the hotspots and the technology for all ages?
At this time, for every single person in the district, we do not. However, every single child in our school district will not need a device. So based on the numbers that have been requested thus far and the anticipated number that may be requested based on option 1, we feel that we have enough devices within Newton County to provide every person that is requesting a device an opportunity to get a device.
Okay, and then should we allow for a period of time for us to see if the technology is going to work before we start getting the kids online to meet with their teachers and start teaching? I mean, would that not be a good idea to go ahead and start sending out the hotspots and the technology and let them see, so we've got time to troubleshoot before we actually start classes?
And I know that Dr. Fayal, and you may want to address this, Dr. Fayal, he's already sent the information to the schools related to how many devices are requested at each school. That was information that was generated from the registration form. Each individual school will disperse their technology devices per school with the other materials that they are sending home with the families at that time.
But wouldn't it be prudent for us to go ahead and do it earlier than later?
Right. Do you know the timeframes for the
Especially
schools?
for people who've experienced problems.
Right.
So like in your case,
Right.
yeah,
Oh, absolutely.
probably need to come out to your house and try different things out.
But you can't do that. You can't come out to everybody's house. So
no,
we're gonna,
yeah.
if we could get those devices in the hands as soon as possible, so we can
absolutely.
troubleshoot.
Yeah.
I just think, that's something that we need to go ahead and do before whatever date we're going back, whether you chose in-person, virtual, or whatnot.
And we certainly can working with the schools to make sure that happens. I think Dr. Fayal would like to share maybe the time frame.
Yeah, right now we are planning on having, as Dr. Thomas mentioned, in conjunction with the materials disbursement at the schools, And I believe the dates we're looking for, correct me if I'm wrong,
August 10th through August 21st is what you all reported to us.
okay. So we're doing it in conjunction with those dates. So as the schools are handing those out, we are giving ourselves at least a week or two before the actual start date of classes for parents and students to get access to their devices and to see if they have any issues.
Okay, thank you. I'm just, like I said, sort of, as I heard the presentation, I took notes and, want to make sure we're thinking along the same lines. And if I come up with ideas that,
Oh, absolutely.
So,
And Ms. Coggins, if I can add, we do have our hotspot plan currently in place, but right now, a lot of internet service providers and telecommunication services are noticing the changing of the landscape. So even as we speak, Spectrum, Xfinity, all these companies are coming up with different types of plans and models that school systems can utilize to assist with connectivity with parents. So what we can do today may change based on some approval at some of these internet service providers on Monday. Literally, I have a conversation going on with Spectrum about something that they're working on offering. I believe some of the board members have been gracious enough to share some of that information with me, and we've been reaching out to these companies and seeing what they offer and can it fit within our budget and what we are able to offer to our stakeholders.
And if I may just add one thing, Ms. Coggin, you sent us something, and I don't remember what the company was, but it was, I don't know, you guys had a meeting already, right? So can you just, is it an infrastructure installation throughout the county, or can you give us just a quick summary of what you heard from them?
Okay, well, it was like two major ones that we've talked.
Not
to.
the Spectrum one, the
Okay.
other one.
The other one was with the company to basically set up repeater antennas throughout the district. That one would be in scope would be too large for the school system to encumber. It would definitely be something that we would need to work with our county and city to kind of create a repeater type internet service. I believe when they talked about this setting up, I believe it was a 10-mile area. It was somewhere about $60 million to kind of get all this stuff in place. So the numbers are pretty high just for us to kind of just create that kind of infrastructure in those areas. But ultimately, we are still, as I mentioned, looking at, as these things are coming in, trying to provide the best solutions to our parents. Because we know, especially in our Mansfield, our New Bern area, there are just some areas that are just struggling to get that high-speed connectivity.
yeah, it's mainly, I think, mine and Trey's districts, the north part of the county, east and south are the big difficulties. And I know somebody told me the other day, why can't we put internet on a bus and park it in the neighborhood? Well, a lot of the neighborhoods in our area, we don't have neighborhoods, and, it may be 2 miles to the nearest house. So, we would literally be putting a bus in every, a yard in order to provide that. I guess, as you can tell, my fear of any virtual is that after the experience we had in the spring, we don't have the infrastructure, the capability as other counties that surround us. It's just, that's what worries me.
Yeah.
So for our job as staff, as, elected officials, is to provide the best education we can that we're able to do. And if you're telling me that, my child's got to learn virtually, which completely backfired, and he has told me over and over again, I cannot do it. He's worried about keeping his grades up because he's got to get into college. In fact, I know I've spoken to several of you and said that. He said that yesterday. He had a meltdown. A 17-year-old is worried, so worried, that his grades are going to fall if we go virtual at any point. He says, I can do it for a week or two when we have to, but for long term, he says, I can't do it. And he is basically crying in our living room, stressed to the max, and that's not fair to him. And if he's doing it, my child's doing it, I just imagine what other people are doing. And they have shared with me that the mental health of their children, just not knowing, regardless if they're doing virtual, regardless if they're doing in person, not knowing is killing them. I know for a fact 2 weeks ago I found out a child started cutting herself. She's now in therapy. You would never in a million years have thought this child, of all people. And when they started with a therapist, it was because of, I'm not in school. I don't do anything. I can't learn this way. I need to go to school. And that also brings me to this, the mental health part of it. If you know, I know we have it available for counselors and that. We all know good and well that kids are not going to go call their counselor. I mean, it's usually the teachers who make the appointment or point it out or say they're here. So, you know, I worry about those kids at home who don't know better, who, you know, don't have the parents that will get them the help or say, go look, here's a counselor. That terrifies me. Somebody asked me the other day, how can you sleep at night if one person were to die from COVID? You know, one student, one staff person. Said, how can you sleep at night knowing that there's a child out there being molested, and the only reason that they would not be, I mean, the only reason they know it's bad, it's not supposed to happen, is because of their teacher who has seen it in person. And that computer does not give you that accessibility. So, you know, so that worries me about all of this. If we, you know, whether you can do technology, we can support the technology, is it really the best route to go? You know, because we all sit here in this room, we all say that in person is the best route. So to me, I'm thinking, what can we do to get our kids back in as soon as possible? It's been 6 months since they've had in-person teaching. When we are scheduled to start on the 24th, if we go into September, you're looking at 7 months away from in-person. So as a team here, what can we do to get them back in person? Ms. Fury, you gave me data, you posted data about how you determine. I've got data that was just released this morning, and it came straight from the Department of Community Health. And
Department of Community Health, meaning
the state.
the people who do our health insurance?
No, not Department of Community Health, I'm sorry, the state public
The
health.
Department of Public Health?
Public health,
Okay.
I'm sorry. The case increase statewide has been 1.7%, and this was statewide.
Yeah.
1 week ago, it was at 2.1, the previous week it was at 2.5, so there's obvious a trend in the state of the positive cases going down. Newton County's average 2 weeks ago was 3.1%. The next week, it was 2%. As of today, it's 1.8%. So we're still going down.
And tell me what that's measuring. I don't know what that number is.
These are 7-day averages.
Okay, that's
7-day averages, yes.
Yeah.
So we've got 1,693 positive cases in Newton County over the whole period. That's 1.57% of the county's population. We have 164 of those cases were related to personal care or nursing homes. Newton County's positive rate is less than 1% of the statewide positivity rate. So in saying all of that, I'm not debating,
Yeah.
you know, what your data is proving and what it's not. But again, it's changing daily, and we're trending on a downward spiral. I mean,
Yeah.
so again, I go back to, if we cannot support a truly virtual way, I mean, for everyone to be educated, regardless if you chose in person or you're going virtual. If we can't support them and offer them the best thing, and our data is trending downward, then what can we do to get all our students back in person as soon as possible? If it's social distancing, you know, okay, so do we put up temporary buildings? You know, do we, instead of spending it on the hot spots at home, do we spend that money on being able to social distance at the schools? You know, things of that nature. I mean, I just think, and I've talked to teachers, and they have some brilliant ideas to social distance. And they have not been asked. There's not been that direct communication with very few of them. So I just, in saying this reopening plan, I think it's great, and you've worked very hard. I mean, I get it. There's so many other variables, and I just want to know that we will be going back to in-person as soon as we can, and what we can do to do that.
And so if that's, I'm sorry, if to answer that question, when you say what can we do, I've been saying it for weeks and weeks and weeks and weeks, and people don't, for whatever reason, feel that they have to participate, but at the same time, if we expect community transmission to decrease, even in nursing homes, because the people who visit nursing homes come out and then they visit their, families. And if they're not wearing masks, staying away from each other and washing their hands, we are going to struggle with this all year long. And we're going to have intermittent closures. We're going to have classes closed, schools closed, opening back up, closing down. And people have to understand that while we are saying that, when I said you can safely open school, I believe in my team. They're not perfect. We can point to instances where, we thought that there was a thing here and it wasn't. It was over there. And so we can point to places where we're not perfect. Parents cannot have the expectation that when they return to school, their children are not going to come down with being ill or be a contact to someone who tested positive. That's a complete and total realistic situation. But in order to decrease that, the people who live in our community have to do what we're asking them to do, period. And you are absolutely right. The numbers, I am sleeping in the numbers. I've been sleeping in them for weeks and days and months and hoping and praying just like everybody else that we can get to a situation where all of our kids and all of our teachers are back and we're just rolling like normal. And we are seeing decreases, but unfortunately, even though they're decreasing, they're still high. And so we have to keep moving those numbers down incrementally, which means that all of us have to be accountable to do the right things. And Ms. Coggin, Ms. Henderson Baker, Mr. Bailey, Mr. Johnson, I'm not sure that the 4, 5, 6 of us in this room can get the folks to help us with that as at a large scale. So somebody told me
No, because we have people sending, and I'm not trying to interrupt, Ms. Fury, but I think of you saying that, and I think of everything that you have said since day one. Everything that you have been clear about since day one, which is this plan is fluid. Right now we have this options, but I'm continuing to monitor the guidance from the Department of Public Health, the local health officials. You said that since day one. Since day one, July 7th or whatever date that's been my communication this entire time, since day one. In emails, that's been my communication. On Facebook, that's been my communication. When parents ask, that's been my communication. It's 3 options now, but you are monitoring. You told us that to begin with. Dr. Barr, the first slide, which I pointed to when you did the first presentation, it said continue to adapt and offer changes as they need to occur. You said that on day one. So, on day one, we have been aware, the entire community has been aware. I don't know why everybody blocked out that sentence, but the entire community has been aware that that was the statement made. When I did updates on July, that's why I have documented, been transparent. I got the dates that I did update from July 7th to July 20th to July 21. You can go through all of my updates and see that it says that statement every single time. But people miss that whole entire second part that you're saying, I will continue to monitor. So that, to me, when you said that on day one, and when Dr. Barr said, continue to adapt and offer changes, in that first slide, it was like the first bullet point. And then the second bullet point was a great deal of, I wrote this down, a great deal of flexibility is needed as we reopen.
So if I can...
And so, let me finish right quick. Since day one that's been said, so I just want people to understand the communication has been clear since day one that this plan may change.
yes.
Yeah.
And I think that's important for people to understand. But going back to what you said about we have to do in the community what we need to do, we have people sending us emails saying nobody is social distancing anymore. People are going to parties. Like, oh my gosh.
Well, and I've received emails from parents that said my child's coming back to school, and they're not wearing a mask, and it doesn't matter what you say or do, they're not doing that, and I'm like, well, then we've got an option for you because there's a virtual choice, and so I want the kids to come back to school. The plan that you're referring to is our plan. So we created a plan that had choice in it on purpose because we knew that there would be specific needs of children and families to have the option to come back to school. We knew that. And so, because we didn't start that way. We started all virtual, we started half on, half off, AB, week off, week on. We did all of those things. And we came back to a place where we landed at what we thought would be most palpable, or most palatable for our community. And that would be the choice, but with the caveat that if things change, we got to be willing to change and move in a direction that protects the health and safety of our families and our kids and our staff. And it is correct that the data is trending down. So case in point, positivity rate in our community was 18.7% a week ago. It's 12.7 now. All right, so it's trending down, but it's still high. It's high by their definition at DPH. It's high by their definition. So again, I want to get back there too, and I have some other options and things that we can think through. But at the end of the day, if you really are looking at the indicators, that's where we are. So I hear you very loudly and clearly. So.
Yeah, and I'm not denying that
Yeah.
what you said. I mean, that has always been,
Yeah.
there's been that caveat.
Yeah.
But based on the information that we presented back in July,
Yeah.
a lot of it's based on data. We
Yeah.
all agree that that's what you've got to look at.
Yeah.
And our data now is still trending
It
downwards.
is.
So, I just want to point that out, that, I think we still need to give that option. But my question to this team, are we ready to go back in person? Or if we're going to say we're ready to go back virtually, everybody's going to start virtually, can we provide that? Can you tell me that we are solidly ready to go back either way? If not, then why don't we look at changing the date of the calendar?
If I can jump in, just for clarity's sake, for right now, we are still on the discussion and update of the reopening plan.
Yes.
And not on the requested board action.
That's correct.
Okay. Then I'll save some of my comments for that section, but for this section, as far as what we saw in the plan that you guys have presented, from the beginning, and Ms. Henderson Baker is exactly right. We've been very clear that if we have to shift and we have to change, then we will make those necessary changes. However, at the very beginning, and the things that you highlighted over and over, even in the slides there, were based on community spread. This community spread, these 3 levels of community spread, all throughout that document that we went over in ad nauseum. We never could get an answer that day what that meant. We never could get a data point. We couldn't get, you guys even said, we don't know. We're going to be leaning into the Department of Health to find out what that might be. So now we get to today, where now, for the first time, we are hearing about what these indicators are. There's 5, you gave us 5 indicators, right? In those 5 indicators, if we could go back through them again, I would love just to make some points. First of all, I'm assuming you guys came up with these indicators, because we've had no say in what those are as a board, and that's fine.
They're DPH indicators, so you have seen them because I've sent them to you in email and commented on them.
But not as, hey, here are the 5 indicators we're using.
No.
Today,
No,
this
no,
is the
no.
first language that we are getting of, these are the 5 indicators that are now driving this decision today, this recommendation, to begin virtually, correct?
Yeah.
Okay. So in the first indicator, this 14-day case rate, that is including nursing homes and assisted living.
So everybody in the community.
All right, so I don't think that's a fair number to use. You said, well, people are visiting nursing homes. Not right now. Most of them
They're
are
not
all
allowed.
on code red
Yeah,
lockdown, So that's just one thing. And this is where, look, I know you guys can probably argue the data as well. We can go back and
Yeah.
forth. But I just want to make sure we're clear on, because this is the first time we're getting, this is the reason why. Can we go to indicator 2?
I want to point out, though, Mr. Bailey, that though people may not be visiting the
work
nursing
there.
homes, they work there.
Thank you.
And they
Sure.
come back out into the community.
Right.
I'm-
And
I
they're
just-
also being tested frequently, right? So, I mean, for every issue with a nursing home, they also have levels of protocol and things as well. We know, right, this is not an easy decision for anybody, so I know we're going to go back and forth, and that's fine. I hope you guys are okay with us doing that. All right, indicator 2, daily new cases. This is a Harvard whatever report. Why did we not use the Department of Health for this one, or for
Or
locally, or Piedmont,
That's my
or,
question. I'm sorry, Mr. Bailey. I do have that question. Have we not talked to our local hospital and talked to them? I mean, have
Well,
we
Dr.
gone?
Schmidt went, yes.
Because met with them and asked them about what their thoughts on it. Because we can pull up the data about how many hospitalizations and all that. But based on my conversations with hospital personnel, they're ready for us to go in person. They work with the people every day who are COVID, and they have not had any transmission between patient and staff member, nor in staff to staff. It's been on the outside. So my question is, in getting this data, have we truly looked at, and talked to our local people who are fighting this day in and day out?
Our health department provides information about hospital utilization, and for some reason, I think they're at 85% capacity. Am I remembering that number correctly?
Yeah.
And so
Yeah,
that's
and
that's
they
some
had
of
to
our most
avert,
recent.
send people to different hospitals.
Well,
Sure.
they do that
That's
every
gonna
day.
happen, yeah.
I mean,
That's gonna
in all
happen.
honesty, for
Yeah.
5 minutes here, 5 minutes there. Okay, I'm sorry.
it's good.
You can tell, we're passionate.
And the purpose for an outside source was just to add some balance. That was the only intention there.
And I'm not implying that you have another reason
No.
to do it.
Right.
I'm just, it
We were getting
seems-
everything from the Georgia Department of Health, and so some folks
And
question
some
those
people
numbers.
think they're connected.
Right. And
So
we
you want to
added-
add
we added something-
unbiased.
We added something that was not connected to anything Georgia-related, so.
Okay.
To offer validity, that's all.
Right. Just the numbers that Abigail was sharing just a moment ago were from the Georgia Department of Public Health, and I didn't see that as one of our sources, which, for that
You
number.
You could do 7-day averages. I mean, I sent you the paperwork, and they don't actually use that on their community dashboard. The three things they use on their community dashboard are the 14-day spread, the positivity, and the ER rates. That's what they use. And
Okay.
so, I looked at, believe me, I have looked at this data probably
you have.
as equally as closely as some people who are in the medical profession, because I thought, is there a way that I could look at the previous week compared to this week and come up with an average? And there's a process for all of that.
Sure.
But we pick things that people would understand,
I get
right?
it.
People understand hospitalization rates. They understand an increasing number. They don't understand, as a matter of fact, the paperwork that is associated with what I sent you, I had to go back through it and read it and kind of tease it apart to see, what does this exactly mean? What would be fabulous is, and we were told, going back to your original statement about the levels of transmission. So that's what they sent to us. There was actually a document leaked from the Department of Public Health that had our counties on it, that had everybody freaking out because we were all red. Everybody across the state was red. And so they pulled it back. What I have been asking for from the Department of Community, or from Public Health, and from Dr. Arona is not a single number, but a dashboard of numbers that help us understand clearly what's going on in our community. And unfortunately, they're not there yet, and because it's a novel virus, it's new. They don't have all the information they need to make those kinds of decisions. So in order for me to decide what's best for our kids and students and families and community as the school system superintendent, I have to look at what's available to me.
I understand.
And try to keep it to a level that people, so it's not complicated where you have to spend the amount of time I'm spending studying the numbers.
Sure.
So, but you're right, it is what it is. And
Yeah.
so,
And our job as board members
Is
is
to
to do
ask
the due diligence,
questions
ask
and
these questions, so.
tear it apart,
All right,
put
so
it back
let's
together
look
again.
at the third indicator then, if you don't mind. Just to, this rate of positivity, and this is the one I probably have, and I know me and Ms. Fury have already kind of discussed this
Yes.
one, that the rate of positivity is I would rather that not be an indicator at all, simply because as we continue moving forward, and let's say people do start wearing masks in public, and they do social distance, and we start seeing cases go down, you're going to see less people get tested. So you're going to see, at some point, there's going to be a shift that says, if you're not sick, don't go get tested, right? So as the number of tests themselves go down, and the number of people who feel ill go to get that test made, get taken, of course that number's going to go up. So just to help with the math, in Newton County, and I heard you reference, but yet not anywhere here, or Mike did, yeah, the 5%. It should be 5% or lower
Yeah.
for us to start back in person. And I would posit that you're never going to get to 5% because as the number of tests decrease and the number of sick people take tests, the positivity rate will, of course, increase. So we're telling people, hey, quarantine, be safe. We're doing all that. All right, if you feel sick, go get a test. Well, if just 10 people, let's do it 100. If 100 people in Newton County go get a test, you're telling me if 5 people come back positive, that's just 5, but only 100 of them went because they felt ill. You can get more than 5. You're going to get 10, you get 15, 20, maybe 50. So I would say that indicator, the rate of positivity, might not even need to be one that we look at because it's based simply on number of tests, number of positives. And I know we have to have some data point.
Sorry.
Is my time up?
No, in fact, it's an alarm because the GNR has an educational
10 o'clock.
Oh, well, there you go.
community
Make sure our
partnership
folks are on
call
the
at
call.
10 o'clock.
We need to tell Allison to go.
And to your
pause?
point, Mr. Bailey, that's the reason for multiple indicators, just to look at it from multiple viewpoints.
Right.
That's,
And-
and
but-
not that these indicators are the end-all, be-all.
Right.
But they do look at it from different perspectives.
Sure.
And that's what we tried to look at, some kind of balanced approach.
And then if we get to and we don't have to keep going through the indicators, but let's say we get now to the end result, which you had a page of all 5 indicators and all 5 were in the red or whatever they were. I didn't see any explanation of, well, what if we just have 1 green and 4 red? What if we have 3?
Right.
Like, that,
I think that's a subsequent discussion.
Yeah.
What we would like to see is some positive trajectory. That's what we'd like to see somewhere. And we see it,
Consistent.
we see it in the first one with the average, what is that, the 7-day average, 14-day
14 day.
average? We see, but that's it.
okay, so that I don't want to paint you in a place that's not right. So let me say something and you counter. What you've offered, though, is 5 indicators that are red.
Right.
So you didn't give us anything that said we're in green anywhere.
'Cause we're
So,
not.
but I'm just saying, the perception, though, could be, just hear me out. The perception, and that's what I'd love for you to clear up. The perception could be, well, it's an easier decision to go virtually. It's easier for the staff. It's easier for the team. Therefore, let's pick some indicators that we know are red. And then this positivity rate, if that never changes and it's always red, we will never go back to school. We'll have to come back to this and go, well, now we need to change our indicators so that we now have something that's better data, better, data-driven results. Or if we have
Yes.
better data, we'll have better decisions. And I that's where I feel odd about choosing some indicators today that, I mean, we can argue those numbers both ways in a lot of these charts. If we pick one, and here's where we are in the world right now, we're in an abundance of inconsistency everywhere, right? There's just an abundance of inconsistency. And I would love for us to do as much work as we can to avoid inconsistency now than to stick up 5 indicators that are all red and maybe none of them will ever be green. And we have no way, like, if these are the 5 we choose, now we're going to wait until all of those are green or 4 of those are green or whatever. That's uncomfortable when I have a district. There's a large number of people in my district are not going to be serviced if we go virtual. And Abigail's given a lot of the reasons why, but primarily because of internet connection. There's just the high-speed internet connection is not in my district. And so, I have people in my district going, you can pick all the other reasons why, but the number one reason is my kids are going to suffer, right? And just back to the very first point that you made at the beginning of your remarks, you would almost never choose virtual over in-person.
Almost never.
Therefore, we're not talking about apples and apples. Like, I feel like we keep talking about these two as like in-person versus virtual. No. We're talking about in-person is absolutely number one, the best way, we all agree.
Indeed.
Everyone in this room.
Yes.
Then B, and a far down on the list B, is a virtual experience. And I think when you measure the gap that's right there, and if you're telling me, sorry, Mr. Bailey, your district is just going to have to do the best they can, and there was nothing in this plan that gave solid solutions to the problems that exist in my district. How can I say, and look, I'm not saying this thing doesn't exist. I buried my grandfather Tuesday, and he was is qualified as a COVID death. I've been in quarantine, right? I've experienced it personally. And I know it's real, but I also know if we don't do something to move forward, there's a large population, particularly in my district, I know part of Abigail's, that will be severely underserviced. And nothing in this plan said, we got you back, we got you covered. That's my greatest concern. I got more points, but I just, for some reason, I feel like my district's getting a little bit overlooked and saying, because no one else is experiencing it. This doesn't really exist outside of maybe part of
District
First
1
and
and, yeah, and District 5.
no one's going to these homes. We don't have neighborhoods. No one's going to these homes and trying to log in on a video call for
Right.
5 hours. Or forget two people trying to
Yeah.
do it in a home. And I know there are obstacles. I really do. And I'm not, even right now, I'm not saying one or the other. I know you guys are thinking about this, but
And it's our responsibility. I mean, your responsibility to make a decision on the instruction for our students. But we, as a board, have to look at it from a fiduciary responsibility. So are we making these expenditures to help with virtual when we're all saying that's not the route to go because it's not the best education? Should we be looking and spending that money on ways to get the kids back in person? And I've talked to parents, me being a parent myself, we're opposed to trailers. You've heard that in the past. But if that's what's needed for my child to have the best education that he can have, they're willing to go back to the trailers. I know there's a workforce issue, because if you do smaller class size, that means you got to hire more teachers or things like that. I get that. But at the same time, if you let the people who want to go virtual, who have the ability to go virtual, then why can't, and we've got 80% of our, based on what I was told, 80% of our staff has said that they are ready to go in person.
Well, I would say that they're not saying they're ready to go in person. They don't qualify under the law to be out.
Okay, well, regardless, you've got 80%
Yeah, there's 80%.
that are basically can do it.
Yeah.
But you've only got 34%, possibly if you split and
Yeah,
add
if
in a
you-
little bit of
it might be
that
higher.
group that never
Responded.
participated, which that's a whole nother ballgame about worrying that, they don't want, we're going to lose those students. So you've got 34%. So surely out of that 80%, we can cover and have the teachers needed for that in-person group of people who want to go in person.
But you have to remember.
I want to say something.
Part of that 80% is also teaching virtual too.
Right,
So
and that's what
it's
I know the
every time.
teachers that I've spoken to are willing to do either way.
Yeah.
They just want a decision so that they can plan on what they are going to do.
Well,
So
we've heard
can
from.
I say something, Ms. Fury? I'm sorry, because I don't want to just throw numbers around. And you did just point out that 80%, the percentage that you're saying cannot do in person are those that have qualifying exceptions that have been reviewed by HR.
Correct.
So they are qualified exceptions, where they have some sort of medical illness,
Right.
some kind of thing. But the other teachers that are left, that 80%, let's just keep it real. They out there right now. That's that other 80%. They're out there right now in front of these doors. So let's not just say that we got 80% that can do it, that are ready to do it, because that 80% is standing in front of these doors right now.
But you can also, that 80% you say is out there, that 80% can be broken down into the ones that are willing to do it in person.
But I just don't want to send a false perception.
But you're sending a
that-
false perception that there's 80% standing
No.
out there that are not
I'm
willing
not-
to go in person.
But Abigail, you're saying that those people are ready to go. Those people are scared. It is grown male teachers calling me crying. They are scared. And we cannot ignore that. And I'm not going to sit here and ignore that by throwing around numbers.
Well, and I agree, there is a risk. But, the fact of the matter is, this disease is out there to stay. It's not going away. Even if they develop a vaccine, it may not work. So in doing this, we've got to get, and we all say that, we've got to get our kids back. And I know it's a politically charged thing, I understand, and I'm not discounting that our employees who are fearful, they don't matter. But we've got to do something to get the kids back. We can't just say we're going to go virtual when we can't support it. And we can work with these teachers. And like I said, I have talked to so many that have brilliant ideas, but they haven't been asked about how to make it work. I have teachers that are fragile, they have medically fragile children at home, who are willing to come back because they know that there's no way a third grader can learn to read online. They are ready to put themselves to risk. Now, I know that that's not everybody, but there are ways around it. You look at the hospitals. You've got nurses and doctors who are working, every day with COVID patients, not even risk by chance, diagnosed COVID patients, and there's not been a transfer. How are they doing it? Why can't we do that for our teachers that are worried about coming in?
I gotta say something because some of your wording, like people are like, I gotta say something. You said people are willing to put themselves at risk. And there's something wrong with that statement by itself. We got people, I have employees just going off on my phone.
Well, and I do too.
Let me finish. I don't think that's a statement that we should be saying, and we should say, okay, well, people are willing to put themselves at risk. Let's go ahead and allow them to put themselves at risk. Because I'm going to tell you something. I've sat long, I've sat hard, and I've told Ms. Fury too, and I've told Trey, and I've told multiple people, what I'm not prepared to do is sit in this board meeting and have a moment of silence because somebody said I was ready to put myself at risk. I'm not prepared to do that. I'm a mental health clinician, and I talk with people about death and dying all the time. But that's something I'm not prepared to sit in this seat and have a moment of silence because somebody's making a statement where they're ready to put themselves at risk. And the teachers are sitting here saying, well, we didn't have a choice. We were asked if we could come back, if we were able to come back. They were never asked, do we want to come back? Do we feel safe to come back? They were asked, are we able to come back? And that was identified by if they had a qualifying exception or not. So when they're telling you they weren't asked, they weren't asked.
And you can't ask those kinds of things that we use the EEOC guidelines so that we wouldn't get ourselves caught up in a legal situation. So
Absolutely.
that's why it was done
They've
the way it
been
was.
saying this, but people are not listening.
Yeah.
I mean, y'all are listening, but you gotta listen. You gotta sit. Sometimes you gotta sit in silence and just listen to what they're saying.
It
But
is,
go
it
ahead,
is
Doc-
both sides
Doc-
though, right? Like
It is both sides.
That 80%, there's both and. There's some that want to come back, there's some that are scared to come back, and
Absolutely, I agree with that, but we can't just put
we
them
just,
all.
we don't know what that number is. the
Right,
thing.
and that's what I'm saying.
Yeah.
Dr. Thomas.
Madam Chair, I would like to just offer a clarifying point as to the opportunity for all of our stakeholders to give us feedback. Back starting in June, we sent out multiple surveys to parents, teachers, students, employees. In the survey, I'm looking at one question in particular. What is your comfort level with students returning in person to school? And it indicated of the people that took the survey, but again, it was sent out to everyone, so everyone did have an opportunity to take the survey. 46% said that they did not have any issues or they felt comfortable with students returning back to school, and 53% said that they were uncomfortable. Additionally,
And Dr. Thomas,
yes, ma'am.
you said June, right?
Of what?
June.
Yes,
June,
yes.
let me fix my math, because I know I'm muffled. You said
Right,
June.
that is in June, yes.
53% in June.
In June, yes,
The
ma'am.
numbers were different then.
They were.
And they
were lower.
already were indicating that.
Yes, ma'am.
Okay, I just want to point that out. Go ahead.
Okay. And then, and so I'm not trying to negate anybody's point of view. I'm just offering some point of clarification from the school system. Additionally, we offered Zoom listening sessions that I hosted myself. It was sent out to everybody. They could participate. They had an opportunity to share what concerns that they have that we needed to consider as we plan to open the school system with the umbrella of COVID-19 being the major issue, and what suggestions did they have for us. And so, again, we had multiple listening sessions where people could provide whatever comment that they wanted us to consider. We also had an opportunity for anyone to call the school system, because I received numerous calls from parents, teachers, community members, emails. There have been other live Facebook Live sessions that we participated in, one with Pastor Baker and one with the NAACP. But again, it was open to anybody who wanted to participate. And then lastly, I want to point out our superintendent has also shared updates with our district leaders along the way of things that are going on so that she can keep everybody abreast of where we are in that particular moment in time. So again, there have been multiple opportunities, and I'm not saying that everybody took advantage of those opportunities, but the opportunities have been there for anybody in our community to share any concerns that they have, provide any suggestions, and I know they could have, done that directly with me, because I've been here all summer long, as you have pointed out before. And then, another thing that I wanted to just say, as a point maybe of comfort, we do know that this is an unprecedented time. So whatever we do, there is not a foolproof solution either way, whether we have in person, whether we have a mixture of in-person or virtual, or whether we go totally virtual. I can say my colleague to my right, Mr. Benjamin Roundtree, who is the Chief Academic Officer, and his team, as well as Dr. Barr and with the Chief Operations Officer, they have been working with their teams all summer long, pulling in stakeholders, trying to develop a plan, and in particular with Mr. Roundtree, a robust instructional plan that can easily be transitioned to a virtual format. I know that in previous board meetings, the directors have come and they've shared the curriculum, the virtual online curriculum that the board did approve. And again, training has been provided, ongoing training will be provided. So I'm pointing that out to say, in reference to when we closed in the spring, we had to immediately close. We did not know we were going to close and stay closed for the duration of the school year. During that time and over the summer, we've had time to reflect, receive feedback, to enhance our practices, again, to get more in-depth training, where I do feel that the curriculum of the teaching and learning department, as well as our school, as it relates to safety, and in my division, as it relates to supports, that we are prepared to go totally virtual. But I'm not saying that there won't be any hiccups. But I do think there are going to be hiccups whether we come to school or whether we're totally virtual or not. So I do want to, state that for the record. But based on all of the information that we have received over these several months, we have really planned to have a robust instructional program that we can offer to our students in Newton County, whether it is virtual or not. Now, I do understand the concern with the internet connections. Dr. Fayal has been, he can tell you every day I'm talking to him. Give me an update. What are you doing? Talk to people. Talk to anybody. Who do I need to talk to? Do I need to go stand in the middle of the street and petition? But we still are working. So the capability, the internet capabilities are greater for access for homes than they were in the spring. I'm not saying that they're perfect, but I just want everybody to know we really are working with the providers to ensure that there is internet capability, and that we can reach everybody, all of our families and students that we serve in Newton County. So I hope that kind of offers, a few points of clarification. And the last thing that I want to share is the funding source. I know that funding was mentioned, and we do have CARES funds that have been given to the district. Some of those funds have already been allocated and approved by the board with expenditures. So just so everybody knows, we don't have an endless pot of money. And again, with the board's approval, those funds have already been allocated. And in particular, with the CARES funds, there are a lot of things that we can do with the CARES funds, but there are certain stipulations with those federal funds that we cannot do. So I just want everybody to keep that in mind as well.
And
Thank you, Dr. Thomas.
Yeah,
And
thank
I'm-
you for getting feedback from the teachers. Thank you for making all those things available. If we haven't given y'all the kudos necessary for that, I know you deserve it, and I know you've been working around the clock. So we do appreciate the plan with all of its
And-
in-depth work, and then where we
I'm
where we
hearing
feel
from
like
the
it lacks.
curriculum directors now, and they're saying we have developed, they want me to announce that we have developed a framework for virtual learning, just as we have a framework normally for in-person learning. So they have begun the training process because of the number of children who had already opted to do that. And the administrators have already been trained, and the instructional coaches will be trained next week. The teachers will be trained on that framework during pre-planning. But I want to reiterate something that Dr. Thomas has already so eloquently said. There are going to be hiccups. We are trying to control for as many things as we can. We've even got to the point where Ms. Furious asked us to anticipate concerns or whatever. And so we're in that mode too. But whatever model is decided upon today, or if we stay where we are, for those parents that have chosen the virtual option, just know that whenever there is a concern, she already mentioned the concern about technology, to contact them. If there's a concern about the curriculum and instruction aspect of it and the teaching aspect of it, just let us know and we will address those. But again, we are in uncharted territory, and I say that because we have to ask the public's patience as we go through this new thing and this new way of teaching for a lot of our teachers. Whether we remain with the plan as it is, we still have children who have selected that virtual model that we still have to address
Serve.
those needs, and there are going to be hiccups. I'm going to admit that readily, but we will work through those and provide children the very best education that we can under the conditions that we have.
Thank you, Dr. Thomas. Thank you, Mr. Roundtree. And to add to that, we said on July 7th, this is new for everybody. So, I mean, I keep using this wording. It's new for everybody. Dr. Fayol, I see you coming to the mic. You want to add something?
I was going to add, to additionally address the concerns, we are also expanding ways that we are going to support families and students. In the fall, we had an email line that parents could email for support. We also now are extending, and each school will have a dedicated phone support line to call in and get on real-time support through that process as well. So to kind of address some of those concerns you had, if someone is having an issue,
Thank
they
you.
can call a number, and we will have a live representative on the line to kind of walk them through the process if need be.
That's been my worry. That's my questions for this is how we're going to support this. And so please don't get me wrong. I mean, I'm not debating, what's best or what, in that regards and saying that we just are not completely capable. I just want to make sure that we have the ability to do it. And to address Ms. Henderson Baker saying that, risk was the wrong word. Teachers coming in should not have to risk their lives, so to speak. But
I appreciate you changing that.
yeah,
'cause
so
that's
that was
that's
the
what
wrong
you
word.
said, and I
I know,
had to
and
stop you.
I get passionate and I don't realize what I'm saying. So I apologize, but that's my point: is what are we doing so they don't have to risk? And so, should we concentrate some of that funding on more in-person technology, for lack of a better word, like what they use at the hospital for nurses and healthcare professionals in is it PPE?
Yeah.
Attire. Is that something that we need to invest in as a school system to protect those teachers so they aren't at risk when they come in to teach? And I'm just throwing this out there.
It's a great idea, and we have thought about it, and we've considered it, and the medical community does not want to hear us say those things because they're having a hard time getting the equipment that they need. So they're recommending for us that we don't use like N95 masks. We use the things that we're using now, or surgical masks that seem to be a little bit more readily available. But teachers have reached out too, to me directly, and have said, dress code. Let's talk about dress code, because when I come in, I want to be able to drop my clothes at the
In a
garage door
washer.
and go in the house. Can I wear scrubs? Yes. Wear what you need to wear to feel when you go back home to your house,
Right.
that you feel you can enter your house safely. And so there's going to need to be, no matter what happens today or any other day, a great deal of flexibility. And that is the word of the year for our school system. Flexibility, patience and care, kindness for each other, making sure that we have the forums to express our opinions, and that when we do so, people are listening. I need to listen. I hear from you, I hear from people in the community, and then I go back to my team and I say, here's what I'm hearing, and they're like, oh my God, stop talking to people, because we might be headed down a path and someone hits me with a really good thought that I hadn't thought about before, and then bam, I'm talking to the team to see what's practical and if it fits in. So I appreciate, Dr. Thomas, you're filling in the gaps there. The other thing that you probably don't remember is we also asked our teachers through our partner Upbeat to talk to us about their experiences in March so that we could learn from the mistakes that were made. And I believe I sent that document to you, and I pointed out that the biggest problems with our teachers are going back, not that the teachers are problems, don't hear that. The biggest problems our teachers experience during the spring. Two things: they struggled to engage students in the learning, and they struggled with the availability of resources at home, not technology resources, but crayons and markers and pencils and paper and things like that. And so that's sort of what we're using, and we actually, Ms. Sanders and I actually spoke on a national conference about how we've used that data as a part of our planning process. And Ms. Henderson Baker and I spoke at a statewide conference, and I used that data to say you gotta look to where you've been to build the path to going to the future. And so just wanted to add that as another opportunity. And we had the most participation in that survey in May than we've ever had. So I feel pretty confident it was a good representation of what our teachers were thinking.
Thank you guys for chiming in. And Mr. Roundtree, I just want to point out something that I said on day one. I'm going back to my old notes. If anybody knows me, know that I document. So, but I asked you the question, at any point, option one will have to be shut down and students have to transition to another option. Will the teachers be ready to go? And you told me yes.
Yes, we are. We're prioritizing because we have a limited number of pre-planning days. And so now with the number of children who selected the virtual option, we've had to go back and redo that because we were trying to give priority to those teachers who would need to teach virtually. But now, since so many of them want it, we had to bring in a wider swath of teachers. But yes, we are getting them as ready as we can envision. Again, with the caveat,
it's new. I
But
said
yes.
that on July 7th. This
Yes.
is new for everyone. We're trotting unknown
Exactly. And
territories.
the
But I
curriculum
wanted to prove the point that you guys already had that mindset in mind. So,
And the secondary director, Dr. Warfield, released on Wednesday around 1-something the pre-planning schedule for secondary, and Dr. Mosley, the elementary director, released the pre-planning schedule of professional learning for the elementary teachers on yesterday. So
great.
it's
And I
already
see
planned, ready to
that
go.
Dr. Fayol and his team also has the Teach for Tomorrow conference coming up. So teachers that's assigned, the Teach for Tomorrow conference is coming up. They all have it on their Twitter for registration. So, I mean, if you're listening, right there.
Yeah.
That's an important fact right now. One thing I do want to make a point about, Abigail, you had mentioned about mental health and social emotional needs of students. And many times, and actually when I'm presenting statewide with Ms. Fury, and the reason why GSBA always asks me to present is because it's on those social emotional needs, and that's my background. So I want to assure people that and right now, mental health clinicians, we're doing things telehealth. So we're doing things through the computer as we speak. My contract that I do with Rockdale Hospital for maternity grief families, that is through the computer. I have not gone back in the hospital because they won't let us come back in there yet. But through that, clinicians are trained to read body language. We don't just listen to what people are saying. We're trained to read body language. And the teachers with that mental health first aid, if you've ever been through that, one of the things they train you on is the body language of your student. So even though they're online, you can still look at, because I don't want people to say, oh, it's impossible. You can still look at the body language. I'm able to look at the body language of people and say, I see that bothers you. What's going on and stuff. And I thought, just to point out, it was an article that you shared that Casey Bethel, my Fort Valley State classmate, shared about, he wrote an article about teaching and whether it's virtual or not. And that's one of the things he said. You can do it both ways in that article. So I just want to help people understand that it's possible to do it. You know, this is new for everybody.
Yeah.
It's new for everybody. But the possibility is there.
Madam Chair. Oh, I'm
Yes.
sorry.
I got 60
Sure.
seconds, less than that. I just wanted to, I know from my district probably needs to hear this, probably all of Newton County needs to hear this. When you made the point that, and you both have, really, when we move into a virtual platform, whether that's August 24th or whether we're forced to do it in November, we're going to be more ready than we were in the spring. Whatever we experience when the first day of school starts or our first day of virtual starts, it's not going to be anything like what they saw in the spring. And I think a lot of even my district's thinking, oh, if we go virtual, it's going to be like it was in the spring. There are some things that will be similar in your experience because of your personal experience. But the system itself, we're talking about different platform, Edgenuity. We're talking about different training for our teachers. Hopefully by then we'll have some of that done. I do want people to hear, if we make that transition, and for some who've already chosen that model, it is not going to be the same. It's going to be much, much different, and the grades will count, and attendance matters, and all of those things. So that was more than 60 seconds. I just wanted to reassure people, it's going to be different, not the same thing
Exactly.
in March, but also not apples to apples for in-person.
And I want to respond in as much as we are working with them specifically on that in the training that the administrators across the district received last week during our leadership conference. They were exposed to a template of look-fors when they visit the virtual classroom. And so they're going to be looking for engagement of the students, engagement of the teachers. It's a whole bevy of things that they were trained on what to look for. And then the teachers, of course, will go through that so that they will know what they need to be doing, not necessarily because the principals and the assistant principal are going to come in looking for those things. They are, but they're going to be trained on it because those are just best practices as it relates to being a virtual teacher. So we're developing and working on that as well.
Thank you.
And
Madam
just-
Chair, I've got one,
Yes.
I'm sorry. Okay, in all of this, we're all going back and forth saying sort of the same thing. I mean, but do we have enough time to prepare? Do we have enough teachers, pre-planning days to teach those that need to teach virtual how to do it? Do we have time to do in person and make logistics? I'm just asking because it seems to me that that seems to be the biggest issue, is that we're just not ready. So my question to you, do we need more time?
Well, we've talked about that too, especially considering just the idea that if we were to elect to be all virtual, we would have to change our strategy to address all teachers because as you heard Mr. Roundtree say, we're really trying to target the groups of teachers who will be virtual teachers, and then everybody has to be a virtual teacher at some point because we may all have to go back and forth. And so they've got a plan that addresses that. However, when we talk about this perhaps transitioning to a virtual environment on the 24th, I think we feel really pressed to try to get all people geared up and ready to go, which,
Well, Ms. Fury,
Yes, ma'am.
because we don't know what you're going to present next. So is that something you need to wait for? Because we're still, just to bring everybody back to where we are, we're still in the questions and the discussion about this part.
But this, I think, goes along with the same thing. Do we
Yeah.
have some options and, are there things that need to be changed in order to present the plan that you're currently presenting? So I think.
But that's going to be presented in the next plan, right?
Well,
Hang on one second before we get there even. just because I know how hard it is. I've been in Mr. Johnson's shoes.
We need to check in.
Like,
I keep watching him. Mr. Johnson, do you have any questions or discussion?
Yes, I have some questions.
Okay, go ahead.
Go today without asking questions?
Go ahead.
Well,
Oh, you went out. You hit mute, Mr. Johnson. You hit mute.
You're on mute. Oh, my goodness.
There you
can you
go.
hear me now?
Yes.
Hey, but Mr. Johnson, I want to have that mute button next time you live in person, though.
Well, this is different for sure, but good morning, everybody. And I want to shout out to the superintendent for sharing that information, very important. And I also want to extend my appreciation to the staff for what they're doing and have done and still got to do. And all about doing, from my perspective, we talk about all the stats and whatever, but we can't leave, in my opinion, two fundamentals. And I think we all should keep this in mind when we are pursuing the right path. And that is, what we're trying to do, is it practical and is it safe? If we can't answer those two questions, we need to go back to the drawing board.
Mr. Johnson, you need to report virtually every time. For those that, and let me say what you just said, because when Mr. Bailey was on technology, I had a lot of people say I could not hear what Mr. Bailey was saying. And so Mr. Johnson said is two things that we need to keep in mind, having hearing all of that. And he said, is it practical and is it safe? And if we can't do all of that, then we need to go back to the drawing board.
Correct. And that's one of the things that's gonna keep me short on talking here this morning. Let me give you an example. I was a bus driver, and I think it's fundamental. And what we do starts at the bus stop. And when we're talking about maintaining or complying with the CDC guidelines, the 6 feet, lo and behold, how do we get the kids on the bus maintaining that requirement and get them to the school in a safe manner? If we can't do that, we gotta go back and think about what we're doing. And in the meantime, let's think about when we get those kids, what we've decided, that we're not gonna have lunch as we know it. That the students are gonna come in to the cafeteria, get their lunch.
And go to the class.
And where are they going? They're going to the classroom. And we know kids going to be kids. And I would say some of the lunches won't make it to the classroom. It's going to be down the hall or on the wall. And our teachers, lo and behold, love them, only got trash cans in their classroom. But when they get there, they need trash barrels. And we haven't thought about, and I haven't heard anything, how are we going to manage that problem? What are the schedule of sanitizing? We haven't heard anything about where we're going to put the sanitizer, the hand washing. How are we going to deal with that? That's a whole new ballgame. To go back to the first statement I said, is it practical? And I don't think it'll meet the practical criteria by not discussing or bringing it up, how are we going to deal with that? And changing classes, sanitizing the room. What are we doing for our custodians? How are we doing it? When are we going to mount the thing? There's so many questions that haven't been answered, in my view. So with that, I won't hold it, meet it up or anything, but I just haven't heard that to get me thinking, where should we be going and how are we doing? And I know a lot of work, done a lot of work, and I don't want to take anything away from what the staff are doing and the information that they're sharing. But we still got more to do, the practical side of it and the safe side of it. Thank you.
Thank you, Mr. Johnson, for your gracious comments. Points well taken. Thank you so much. Before we move to the next section, I did want to point out something as well. I don't know if Dr. Barr said it or Ms. Fury, you said it, but I actually had already wrote that in my comments to remind people that in our strategic plan, I just want the community to understand this, because I know there's some community people like, but anyway, I want y'all to understand this. But our strategic plan is the guiding force behind how we operate our school system. If it does not line up with the strategic plan, then you might as well throw the thing out the door. And the strategic plan, goal area 4, organizational and operational effectiveness, says to ensure a systemic culture of safety. That is in that strategic plan. The other thing about the strategic plan is not made up by just school system officials, but the strategic plan process actually involves the community and the stakeholders, as you have to have their input. So you guys, the community, put input in this plan. Just want to remind people of that. Thank you.
That's a great point.
Okay, we're ready for the next session. We're ready for new business. Finally, new business.
So, the new business is just my recommendation, given where we are and all of the discussion that we have had up to this point. And my recommendation is that we move to a virtual environment and monitor the data and plan, prepare, and get ready, along with the community helping us drill down those numbers to get them lower so that we can immediately return to an in-person environment that provides choice to families, in person, and those who like virtual and choose to make that choice can continue to stay. And so that's where we are today. There's also,
Yeah, it was a long pause.
there's also a secondary option that you as a board can consider that will help us prepare for our options, in person and virtual, moving forward, and that would be to adjust the calendar. And the calendar adjustment would allow for us to continue to work, to prepare teachers, to provide additional professional learning, to get in more of the supplies for sanitizing classrooms and doing all of the things that we would need to do to welcome students back in an in-person model. It would also provide us more time to continue to monitor the data. As we pointed out, we are seeing downward trajectories with the data. However, the data still points to being high. And so while a virtual option is there as well, my secondary for you to consider, because I know how much of a challenge this is for our board and our community to give our school system until the Tuesday after Labor Day to return to school. And it might get at that point that we have to go virtual. Maybe things will improve, maybe they won't. But at the end of the day, we don't have the numbers. We can't see in the tea leaves exactly what's going to happen. But this would buy for our school system and our community time, and would not cause us to deviate from the current recommendation in our plan, if that makes sense. Does that make sense?
I needed some clarity.
I would need clarity on what the motion would be.
Okay.
Or I can make a motion.
Yeah, you definitely can make a motion, and then I will tell you.
Okay.
You know, my recommendation started with moving to a virtual environment, but as a secondary recommendation, extending the calendar so that we can preserve the original plan, and watch numbers, prepare teachers, and buy some time for the numbers to change. So however you want to put that into a...
Are you combining, I'm confused by your but. So are you combining that, because but is conjunction.
Yes.
So are you combining that together, or are you, when you say...
I'm giving you a choice, is what I'm saying, as a recommendation. So you can take them separately and say, or I can just say, let's change the calendar, and move from there. Because my original recommendation was based on the numbers to go virtual, but the other option would be to change the calendar, which would buy us time. So.
Madam Chair.
Okay. Go ahead, Mr. Bailey. Are you making a motion? 'Cause
No, I was
need.
going to ask about the
Okay.
motion. So
Okay.
may I make a motion, and then we will have something to move forward?
We will, but I need to listen to the recommendation, because I'm still confused.
On what the
What she, as the operational officer,
Yes.
the executive operational officer
Yes.
of the school, which I have been telling the
Yes.
community that too, to be clear, it must come from the executive operational officer of the school district.
Correct.
Not us.
The recommendation can.
The recommendation it has to come from the superintendent. So I need to get clarity on what, I'm still confused as to, I heard you say either or, but I need to get clarity on that September,
Is it the
September
8th,
8th.
7th, September 8th?
September 8th.
So.
September 8th.
So my recommendation would be,
Because I think, and let me hold you, I think you need to add some dialogue needs to be given in that. Just like on July 7th, when you said, this is the recommendation, but it's depending on, I think we need to be clear in the messaging on that. You know, what is that September 8th date going to be dependent on? Also, or how are you saying to open September 8th? And then if that's not open that way, it can transition. So either saying September 8th with choices or September 8th virtual. However, if the numbers, the data that you guys are using
Right.
changes, then we can go with the
Right.
the choices. I think it just needs to be spelled out clear from day one, even though it was spelled out clear from day one on July 7th.
The second they won.
yes.
I think, yes, the second day one, it needs to be
Sure.
spelled out clear. Not
understand what you're
and let
saying.
me not just stop there. It also needs to be put on the website, the
yeah.
entire language. That's something that I saw the Cobb County School District
Yeah.
do, that they put on there that, hey, this is the phase-in plan, but we don't have a date yet because we're monitoring the
Doing
data and giving.
Absolutely. Yes.
So I think it just needs to be spelled out.
Yes, so there you have it. So my recommendation to you is to adjust the calendar to move the start date for students to September the 8th, Tuesday, the September the 8th. In doing so, teachers would still report on their normal schedule, which would then reduce the student calendar to 170 days. However, that being said, that's the change of the calendar. From today's date, which is,
The 7th.
the 7th, from August the 7th until close to the end of the month. Of course, I will provide you with updates regularly. If we have to come back and meet again to have a conversation about where we are, we will continue to monitor the conditions of our community in the event that we are unable to continue to offer options for parents. So in other words, adjust the calendar now, monitor, get teachers back in our buildings, start students on September the 8th, if the conditions permit to allow for in-person and virtual. So parents don't have to do anything if they've selected in-person, and they don't have to do anything if they selected virtual. Between now and then, we have to look at the numbers to see if we have to say, for starting September 8th, we will be virtual. Or maybe everything will go away and we'll be 100% everybody back in the classrooms.
Or
May
or we
I-
have the option.
Yes,
May I say something?
yes.
Because as of today, you're saying virtual. So why wouldn't you make the recommendation on September 8th to start virtual? And if things change, then you will offer choices.
Because I'm trying to make sure that we respect the plan that was put forward in the beginning. And so that it doesn't cause people to have to shift from where they are to start something new than to perhaps shift all the way back. I would rather, and I think my team would rather leave things the way that they are, and then if we have to go completely virtual, switch at that time, rather than switch now and then untangle that later on. It's just
Now,
the
I'm
logistics.
going to body language. I'm looking at the team. And I
Hey, that's not fair.
don't think that's what they're thinking.
you got a
Because
gift.
they're
So you would want
preparing,
everybody to go
they're
virtual and then
preparing,
undo it
because we just
if we
heard
change?
how much preparation they're doing in being virtual. So, and that's why I'm asking, because
Yeah.
the entire discussion that we just heard
Yeah.
is how they're preparing for virtual.
Yeah,
Which
yeah,
is
yeah.
an option either way, though.
It is
Still
an
have-
option either way.
Okay.
But now you're saying, wait a minute, but y'all need to go back to preparing for this too. So,
Okay, I understand what you're saying. I understand.
But it doesn't sound like it's lost work. If we're going to.
I mean, you
it's
gotta
these-
be prepared for both, but.
Right, but if we have
now
an
they've-
option-
But they've changed where the
So now they're trying to do both.
where the priority was going.
I understand, yeah, you're right.
That's true.
But I will say, either way, whether the plans stay as they are or we start all virtual, and this may muddy it either way.
Come on.
But my point is, we need the time
The time.
regardless.
We got
Okay.
the September 8th
Good.
down pat. We
Okay,
understand
we
that.
need the time
It's
for
the
training either way.
It's the second part
It's
that
part
we're
B.
all trying to get
Right.
clarity on.
Okay,
We
good.
have that down pat. So, I mean, if we've had this whole discussion, I'm just confused as why the recommendation would be to start there, and then if we could shift, because we just heard the team say they're preparing
Yeah.
to start there.
Yeah, and I'm afraid that, you know, if parents hear us say, we're going 100% virtual right now, then that 34% of parents have to make a different choice. And so in order for that to not happen,
But that 34% also is saying they need planning time. They need time to, you know, if they're working parents, they need time to say, and we've seen emails
Yeah.
that say that.
Yeah. Which
That
is
they
why there's
need
no
time, they
training
need to
system.
know. And so
Yeah.
that, you know, being I mean, that's just the mental part of what I do naturally,
Yeah.
you know, as a counselor.
Yeah.
So, but the mentality that you're saying is, we're going to do this, you know, that's what they're going to hear. So when the preparation for them could be also, well, what I heard is we're going virtual, and let me go ahead and have a plan in place for that. But it's easier for them to take that plan out if we go face to face. You see what I'm saying?
Yeah.
Like if I hear that we have choices, right, on September 8th, I'm not going to plan necessarily for childcare and stuff, because what I heard you say, which is what happened from the July 7th,
Yeah.
let's be fair, I'm not going to plan for those things, because what I heard you say is that we have choices. But if I hear you say that on September 8th, that we will go to virtual, but if things look where we need for them to look, we will then go back to the choice option. As a parent, I'm going to plan for that virtual mentality and start getting that plan in place. And it's easier for me to tell whoever I've asked for childcare, I no longer need it.
I definitely see your point. I think if we stick with what the original plan was, that had not changed in the people's minds until today. So today is now now I'm having to think about it differently. If we continue in the mindset of what we already had communicated, despite the presentation today, because all of this work is still necessary because we do have virtual students
Yeah.
who've made that choice. And all of our parents, like you said from the beginning, that they are prepared to make the shift if necessary. So we're already hopefully communicating that we're going to give you the choice.
I
If
got
we
teachers and
can't,
administrators saying, yeah.
Yeah, but if we
you need to
can't,
say it the way I
then-
just said it.
yeah, then we'll make the shift, and
I don't have
and people will have to make that arrangement then. But they're should be preparing that way already. That I
Well,
might
we
have to make
thought
the
they
shift.
would be, and I'm just bringing that point because I pointed out at the beginning that this was the continuous dialogue
Yeah.
that was lost along the way.
Yeah.
So you would have thought they would have been prepared, knowing that on July 7th, that was the dialogue from day one,
Yeah.
but they weren't. So being a person that works with mine, you know, I'm just telling you, the way you say it is going to be how it comes off in people's mind and provide that preparation.
That's correct. That's right. I agree.
So I do serve at the pleasure of the board. So I am happy to make the recommendation. You know, my opening statements pointed to the fact that at this given point in time, I feel like we need to transition to a virtual environment. That I believe. But I also understand the consternation that is experienced in our community and among our board members, which is why I posed a secondary option that would allow for us to extend the time, look at more data. So if what I'm hearing you say is we need to transition to a completely virtual option while the team is still preparing for in-person instruction in the event that the numbers change, then we will know more at the end of the month, and then we can make that determination at that time, if that's what I'm hearing everybody say.
Yes.
Am I hearing that, or am I not hearing?
I'm just making sure what I heard you say, because is that the plan that you originally rolled out to us is still the plan going into September 8th. And if we have to change it, we will change it.
That's what I said originally, but then I'm hearing a
Oh,
different.
so that's not what you would then be making the motion. That would not be what you're recommending today.
Right, what I'm recommending, that's why I said I have a secondary option.
Yep, got you.
My recommendation was to move to a virtual environment.
But that was based on an August 23rd, 4th, whatever it was, start date. Your opening statement was at this
Correct.
time, starting on this date.
Correct.
Okay. So now, if you're
So
saying.
now
if
I'm
The beginning of
saying-
the statement is we can move the date till September
September the 8th, at which point we can,
Open up with a choice.
perhaps, depending upon what the numbers say.
Right.
Yes,
right.
depending
As long
upon
as
what the
that's
numbers say.
Still what we said, that's still what we said in July. That's all I'm saying. It's the same thing.
I just want to make sure that everybody's on the same page, because I'm hearing Ms. Henderson Baker say, say you're opening virtually and then change it back to in-person if the numbers permit, even on September the 8th, or leave the plan as it was, prepare to be in virtual and still open on September 8th, thereby allowing more time to prepare everybody to be virtual teachers and watch the numbers and go from there. So again, that's the problem that we face
Yep. That-
as a board and as a team.
Right. That's not what I would, that was not what I would,
Would think,
yeah. That would be hard for me to get behind that recommendation,
right?
switching it like that, because I
Right.
feel like the date was important.
Yes.
Right? So to me, if, just keep your recommendation then to start on the 23rd or 4th virtually, if that's the case.
Right.
But if you're going to build in the time, then say, the reason we're building in the time is so that we're prepared to go with choice, and we'll figure out that now we're going to use this time to both prepare our staff for virtual, the ones who aren't prepared yet, and at the same time, be looking for the way to make it as safe and practical, like Mr. Johnson was saying, as possible for in-person, because that's still option A for all of us in this room. Like, it's not apples and oranges. That's where my point was. If we move the date, let's continue to keep the options open and the choice for the parents, because we now have time to make it safe and practical. But if we don't, I don't see the need to move the date if it's just about starting virtually, other than some of the training.
Yeah, there's training needs for sure.
Yeah.
Because we weren't planning to train all teachers all at the same time. So we would need to change the date, period.
Madam Chair.
Yes.
I'm not sure if this is the right, because I don't think we've actually made a
We
motion for
haven't.
discussion.
We're just talking about it right now.
Okay,
Just talking.
so,
And let me say this actually, so for clarity, actually, this actually does not require action. Because as the executive officer, you can make the recommendation by yourself, really. You actually, by law, can decide what it is that you want to do. So I just want that, to put that out there as
But
well.
if
Other
she
than the start
changes the calendar at any point,
Yeah.
that's when
The
we have to
calendar,
do.
we have to approve,
So that's
yes.
what my question is. Okay, so you said that the teachers would come in their normal start date, which is August 14th.
Correct.
So if we were to change the date, regardless of virtual or in person, and then we would shorten the student days to 170. What does that do to our food, nutrition, bus drivers, and all those? Will they lose money?
I think would they still deliver lunches and things, or no?
I mean, it's not during the school year.
I am so sorry, but I don't know what scenario we're on.
Okay, so I'm sorry.
That's
So, you know, so if we bring the teachers in for
Yeah.
their, 190, is that normally their
Yeah,
contract?
190 days.
Okay,
That's
so they would still come in, and then we shorten the calendar for our students to
Yes.
170.
Yes.
What does that do to our bus drivers, food nutrition, the staff that, as you said, when we've talked
Yeah.
about changing the calendar,
Yeah.
they will be the ones to suffer, so to speak. They're the ones that they're not under contract, and how would we provide that?
Right, well, based on that scenario, which is, I would say that we would work towards finding a way to deliver still meals to kids like we're doing right now, to the fullest extent possible.
But we
To
can't
expand
guarantee that.
No, right now I cannot.
Okay, so there is a chance that we would have to I mean, they would not get paid or would not be working. I mean, I'm looking at numbers. So that is a possibility.
Yeah.
Okay, so I just want us to think about this in making this decision, that this may affect our staff. They may not make the money that they were, thought they would by shortening our school days to 170. And then, okay, say, for instance, if you were to make your motion to where we are starting virtually, end of story. What if parents decide, and I know a lot of people have already reached out to to me and said, we will move our students. They will not be here. How is that going to affect our budget for FTE counts?
It will not affect it this year. It would be 18 months from now that we would
Okay,
experience
so,
that.
well, 18 months from now.
Yeah,
It will affect us.
It will affect us. Okay,
Yeah.
so,
Unless there's an uptick, that balances at another
yeah,
place.
it balances
so.
out. But there's that possibility that we're going to
Absolutely.
lose
There's a lot of
money
possibilities, yes.
from FTE counts.
Yep.
Okay, thinking through the whole, I think that may be it. When it comes to the money. Yes,
Yeah.
that should be it.
So again, there are no good solutions to any of this. There really isn't. Go ahead.
I'm sorry, I do have one more thing. If you bring your teachers in, and a lot of them have their own children at home, and this is a big thing about the virtual is what am I going to do for childcare? I've got to be at work. What are we going to, you're going to require the teachers to, even if we teach all virtual, will they be in the schools? And will they be allowed to bring their children to school? Tell me how that's going to work.
So no, the people, that's the Families First Coronavirus Act. If they don't have childcare, they can qualify under that, and they can actually teach virtually from home. However, there are those who don't qualify for those accommodations would be required to report to the school buildings and work within their classrooms. And the principals and assistant principals would be working to establish how they get in and get out, which would eliminate, for the most part, people needing, support with technology, because
Right.
we'd be able to provide that. And so they would have to have, depending upon the size of the school, different entrances for different people so they could social distance on their way in. And once they get into their classrooms, then they are good to go. So.
Well, my question then is about the childcare. So say, for instance, you've got a teacher at East Newton. She's got to, she doesn't qualify for that, or said that she doesn't qualify, but she's got 2 young students. They don't have childcare at home. Even if they put them into a daycare, as one parent told me, our daycare is not set up to teach
Right.
online learning. And that's the issue facing a lot of parents out there by us going completely virtual.
Right.
They're talking about having to quit their jobs to stay home to do this. So are we going to provide childcare for our teachers and our staff? And if we do, is that fair to the other, 17,000 parents out there that have the same issues? And can we at least, if there is an opportunity for them to fall under the family medical leave, can we present that to our parents? Can we send that information out? Because if it's available to our teachers, isn't it available to everybody?
It is available.
So can we broadcast that so that they can figure out how to fall under that act?
And pardon me, just since we're on the YouTube, wherever we are.
Right.
Anybody who is employed is eligible for the Families First Coronavirus Response Act, and it articulates the difference is that you have to consider whether or not the job can be done from home. And so I'm not at the other employers in the community, and some of their jobs cannot be done from home. So they have 10 days, the first 10 days, then it goes into an emergency family medical leave that they can apply for at the same time for childcare or elder care. And the rate of pay is different. It's 2/3 of your daily rate, up to $200 a day. I think that's correct, up to $200 a day. So parents in our community are eligible for that for 10 days, and that then can be extended to 10 more weeks after that. So anybody who's employed has that opportunity.
Well, that's what being on YouTube, I want to make sure that parents out there that are having the issue with the childcare regardless, that is an option for them. So if we can communicate as much of that information out there via our social media, our websites, and YouTube.
And I also want to say there's maybe a qualifier in there for the size of the company.
Okay.
So size of company matters, and whether or not they're private or public matters. And so I studied the Families First Coronavirus Response Act for our district. And so I don't want to provide inappropriate or inaccurate information to our families. So they would need to talk to their HR folks
Right.
to determine where they fall in that act, because some companies they may be excluded based on
Right.
size or whether or not they're nonprofit or profit, so.
Well, thank you. I just wanted to make sure that,
Yeah.
our virtual world knew about it.
May I make a motion? I'm gonna make a motion, and I'm gonna state why I'm making the motion, and I think I'm just looking at the body language. I mean, I'm trying to read body language. I'm looking at the body language. So I'd like to make a motion for a 5-minute recess for you to consult with your chiefs
Perfect.
for the recommendation that you would like to bring forward. If I can have a second for that.
Second.
Okay, I got a second. All in favor?
Sorry.
Okay,
Nobody.
okay, perfect.
5 minutes.
Okay, 5 minutes. So if you guys return at, it's 10:59, we don't say 6, 11:05, just to make it even. Yeah, I'm just looking at everybody's body language, and I'm like, I think you guys need to consult together.
And for those watching at home, this
Okay, I'd like to call the meeting back to order. I know we went over the 5 minutes. They needed a longer amount of time, so I'm calling the meeting back to order to resume at 11:29. Okay, so recommendation.
Yes, Madam Chair. I recommend that we continue with our current August the 24th start date, and we move to a virtual, 100% virtual environment.
Okay, so the superintendent's recommendation is to begin August 24th, 100% virtual. She presented on that today. The presentation was on that and spoke on that. Is there a motion on the floor? I'll make the motion. Do I have a second? Okay, it's been moved and second. Floor is open for any discussion.
Madam Chair, may I?
Yes.
I've just prepared a short statement, so I will try to be brief, but some of this highlights what we've already discussed. Number one, just the major concerns of completely virtual learning model, and here they are. First, under normal circumstances, we know that virtual is not our recommended first option for the educational excellence for all. Ms. Fury, you've said that at the very beginning, and we've all agreed that that's not our first, if under normal circumstances, not our first recommendation. Maybe for a few, but as a system, we wouldn't recommend virtual learning if other options were available. And I believe this is an important point because we're not talking about two learning models that are equal, and we all agree with that. We're talking about an in-person option that we all agree is the best way to educate the majority of the students. This helps us with IEPs, it helps us with special needs, and all assortment of educational opportunities. But versus a virtual model, we know that's a distant second in effectiveness. Point number two is just it's not an equitable solution for the entire county. High-speed internet availability is limited throughout District 1, and I know partially in District 5. We've talked a lot about safety, and in most of the slides we saw about safety, we were talking about physical safety from COVID-19. But mental, physical, and emotional well-being of our students, that full health should be something that we have to think about. A longer quarantine period without social interaction will increase depression, potential suicide, emotional well-being, and increased domestic violence. As the number one reporter to DFACS is the school system, if they're not in our person, in our presence, then we're going to lose a lot of first reporters. And lastly, the economic impact. The economic impact for parents, some will likely have to quit their jobs to be home with their children, maybe even potentially move out of Newton County, and we would be losing them in that regard. Also for our employees, the economic impact on our employees. If we go completely virtual, we have to figure out paras, bus drivers, nutrition, custodians, and I know all of those we've touched on briefly, but we don't have solid answers for all of that. So what are the primary two learning models? What are the primary two learning models that all the stakeholders in Newton County are asking for? They want virtual and they want in-person. Those are the overwhelming majority of our county wants one of those two options. Therefore, the best solution we have is to give the most stakeholders what they each want. That's to give them the option to choose between virtual and in-person. That's what the superintendent recommended a few weeks ago. That was the plan that was being built, and I believe that's still the best option for our county, despite some of the information that we've already heard today. So why not do what counties to our west, like Rockdale and Henry, have done and start all virtual? Or why not do what counties to our east, Walton, Morgan, and Jasper, what they've done and offer a choice for in-person? And herein, to me, lies the core issue. Newton County is unique. We are not Metro Atlanta, and we're not rural Georgia. We're both. Newton County is in between, and being in between makes us different, and that means we might need a different solution. We have a segment of our population who think, feel, and who identify with Metro Atlanta. We have a segment of our population who think, feel, and identify with rural Georgia. One is not better than the other. One is not right and the other wrong. And this is why Newton needs a choice. By offering a choice, we're giving the stakeholders an opportunity to choose the option that best fits their family. And with opportunity to choose does come risk. I'm not advocating for being reckless or ignoring science or even being political. Like General George Patton said, taking calculated risks is quite different from being rash. I am not about being rash, but I am fine with having calculated risks. I'm saying that we recognize those risks, we mitigate those risks as best we can, with safety protocol, deeper cleanings, increased awareness, these things that Mr. Johnson has already presented to us, safe and practical. And then we let the parents decide if the risk is worth it for their family. And obviously, if we see the in-person model beginning to cause serious health issues for our community, then we must pivot. We all agree to that already. So, how can we stand together as a one Newton? What we have been a proponent of for a long time, for our Board of Commissioners is a proponent, our chairman of the Board of Commissioners has been a proponent of one Newton for a long time, and I stand with him on that. I believe that each board representative is trying to advocate for what is best for their district, as well they should, and then for what we believe is best for the entire county. And working together, having conversations, even difficult ones, makes us a stronger board, a stronger school system, and ultimately a stronger community. I believe if individually or even individual districts are allowed to make the decision for the entire county, we will be missing an opportunity for unity. Unity does not equal uniformity. And unity is when we each come together from different perspectives and we can agree to work together for the common good, which is the will of the stakeholders. I believe this team is working toward becoming a cord of three strands that is not easily broken. So if we can embrace, even celebrate the diversity while agreeing to disagree on some of the minor points, but offering a solution that works for all of Newton, all of our students is what we preach all the time. Now, I believe we're moving closer to a one Newton when we recognize the uniqueness of Newton County instead of a one-size-fits-all. We're not Metro Atlanta, we're not rural Georgia, we are both. So I'm grateful for this board. We've had some difficult conversations over the phone with each other, with the superintendent we've wrestled with this, we've looked at data. This team has done an incredible work, and so just kudos to you. And I think we are truly trying to hear each other, and I think that's going to make us stronger, regardless of the outcome of this vote. So I appreciate you letting me share, and I am longing for the day where our three strands are one cord, and I think we are going to get there one day. Thank you.
Thank you, Ms. Bailey. Floor is still open for discussion. Mr. Johnson?
Yes, can you hear me?
Yes.
Okay. Well, I appreciate what I've heard, and you make some valid points. But I am voting on the motion. I'm not necessarily voting on what I think, voting on that is the ultimate or the best solution that's for us. But I have to go back to the simplicity approach that I took earlier. Is it safe to send our kids to school? Again, we'll have to start from the bus stop. And we can't maintain the distance that's required. And in other parts of our school building, we cannot maintain that and be safe. I personally don't want to be part of a decision, a wrong decision, a bad decision that's going to say, send our kids to school in an unsafe environment, and the kid, student, teacher, staff come down with the virus, and the ultimate sacrifice is made. I can't live with that. So let's avoid putting ourselves in that position. We got other choices and delays that we can go through. Let's not put the ultimate decision on 4 people that's going to decide what's going to happen. And that's what we are doing. Let's not do that. Let's not send our kids in harm's way. And we know it's there, but we just don't have the will and attitude to correct it before we make that decision. Thank you.
Absolutely. Thank you, Mr. Johnson. I'm not sure if everybody could hear his comment on the live feed. They could? Okay. Thank you so much. Any other discussion? I do have discussion. I've already said, I'm like Mr. Johnson. I can't do this. I don't want to be put in a position where I will have a moment of silence for a decision when people are saying, let people decide if that's the risk they want to take. Because the liability, regardless if they decide if that's the risk they want to take, the liability falls on us. We've been in executive sessions where we've seen lawsuits, and we know that. We know that for a fact. So regardless of the law says we don't have to be responsible, we know that suitors still come. We know that. So the other thing is, going back to what I said about the strategic plan that is made up by community members and this entire school system, goal area 4 for organizational and operational effectiveness. How the school system operates says ensure a systemic culture of safety, and at the present moment, we cannot do that. And if you vote no, then what you're saying is that you don't believe in our strategic plan.
Madam Chair, may I have the floor? I disagree with you there. If we vote no, we don't agree with this, the plan, because you're absolutely right. We've got to think about the safety of our students as well as our staff. We have not heard today what we can do. I mean, we all agree that in-person is the way to go, ultimately. But we have not heard all the safety steps, the protocols that we are putting in place to keep our students safe. We're saying virtual, but we know we don't have the infrastructure to support a complete virtual education right now. So what are we doing to keep our students and our faculty safe? Are we sanitizing? Do we have foggers? Are we providing the PPE shield, clothing, shields, whatever? We haven't heard that today.
Well, I
So
can tell you my
disagree.
personal experience. I'll share my personal experience. My personal experience is that we haven't been able to do that. I have 2 personal experiences that we have not been able to do it, and I emailed the superintendent about it. Now, that's no knock against the team, but I emailed because I said we were ensured that this would happen in our reopen plan. One had to do with one of the things that she says we must do on a continuous basis, which is sanitize and wash our hands. We heard the W's that she mentioned. So I have a child that is involved in an activity that's going on this summer. There was zero sanitizer available, and the plan said plentiful sanitizer. So we failed there. Not only did we fail on day 1, but we failed on day 2. Now, I called the school because I wanted the school to know that they are not at fault, because I didn't want that interpretation on the school. It's not so the team is not at fault. I don't want that interpretation on the team, but it was to prove a point when I talked to her about it that we have some promises that we made, and if we cannot guarantee those promises in that reopening plan at the minimum level, when you got 20 girls in an activity, then what are we going to do when the entire school building open up with these people?
My point exactly about
The
virtual.
second situation I had that happened with was to do with the mask. So here we go with the mask. That's not being implemented. And we said mask, our words was mask is expected. Here again, we have a small group of students with no mask congregating together. We've seen what happens. We have people testing positive right now. That's again something that we cannot ensure at this moment. So I'm using 2 experiences that I had with less than 20 people. And we talking about opening up a school building.
You're absolutely right. I mean, that is my point with the virtual. We do not have the capabilities to provide all students with a virtual platform. I mean, we haven't, we said we would try. So to me, you can't say
We
we're
don't
gonna
know
go
that
virtual.
yet because we have not done that yet. Dr. Thomas just said what she has presented, but what we do know is the 2 experiences that I just named.
Well, exactly, but that was the summer. We're talking about opening up now. So do we have those? That's my question. Do we have the ability to keep our facility safe? Whether we choose virtual or not. I mean, you all are coming in here every day. Principals are coming in every day. We're going to ask our teachers to come in. They've already started leadership meetings. And, you brought out that there was no sanitizer. So what are we doing, either way, to keep our facility safe? I've not heard that today. But I have heard about virtual. And we cannot support,
But
infrastructurally wise, for all of our students to have it. So neither one is right or wrong.
But in
so
Ms.
I'm
Fury's
advocating
speech-
for choice.
That's fine.
That's
but-
all I'm doing.
But in Ms. Fury's speech, she even mentioned that the plan was great, but there have been some things in the plan that they have been unable to fully do. Did you not say that in your opening speech?
Yeah. Yeah.
You
and I-
acknowledged that.
And I also said that there's a difference between opening safely, because that's been said, and is it safe to open? There's those two different things. And so based upon our plan that we presented on July the 7th, and we're following the plan, that plan would say that if you are high transmission rate, then we would move to a virtual environment, which is why I made the recommendation that I've made.
And we've
fully
seen what has
understanding-
happened with school districts that have opened up, where their entire workforce and students were affected.
So it sounds like what the motion on the floor is that the start date remains the same as previously presented, already agreed on by this board, and that we would start, the new recommendation then would be to start virtual.
Correct.
And I think, based on the conversation from all four of us so far, it sounds like that at minimal, we need more time. I'm fine with us voting on this recommendation as it is right now, but I think we're going to probably want to come back and at least explore another motion that might point towards a start date further out in order for us to have time to address all the issues that we have brought up to allow us to be ready for either virtual and/or in person, that it's safe and practical, and that we're getting the best opportunity for our kids.
Can I speak again, please?
Yes, go ahead, Mr. Johnson.
That was a comment that I made earlier, Mr. Bailey, and how we structure our motion. And I see going forward that we can come up with a solution by voting on this, or so they fail or whatever, and making a motion that would encompass more time so that it will address Ms. Coggin's concerns about are we prepared, operational. I think that is a challenge. I think that's something can be accomplished much more in a professional manner than trying to make persons safe, which you can't do. But I firmly believe we can make it operational and be competitive and retain the improvements that we make and keep them downstream. So that was my earlier commitment that I would like to do, and I still like to do that. That's what's guiding my intent on this motion
Yeah.
up front.
Madam Chair,
Thank you.
Madam Chair, may I call for the question?
Yeah, I have to call for the question.
Okay.
So I'll call for the question. Is there any other discussion? I want to remind you guys too, any other discussion that we still meet without a crowd being able to come in? Any other discussion?
I have one question, and it's something to think about as well. Somebody pointed out to me that we really haven't heard, even for the virtual plan, about our special education students and how that will be taken care of, the IEPs. I know, was it Henry and maybe Jasper? They redid all their IEPs over the summer. We have not done that yet. From what I've understood, we have not met to change the IEPs, so how will we have a virtual instruction or be able to accommodate those special needs?
Well, I know Ms. Ramsey and her team have been working feverishly on that. She reported it as late as yesterday during a meeting that we were on to discuss the options, because that was a question that came up, that they are way down the road. Now, they may not have convened the IEP teams as of yet because teachers are still off contract, and teachers, of course, are part of the IEP team. But I have said in every session that I've been in that we are duly bound by law to follow what is written in the IEP, and I know that they are going to adjust the IEPs based on student needs, balancing that against us being in a virtual model. So they may not have met with the teams yet, but I know they're working on getting all of that ready.
Okay, but are you confident that we can have that done before the 24th start date?
Yes, ma'am. Well, they're going to have to, because they need to have, the IEPs in place by then. As Ms. Fury has already said, and as I've said, we are, pushing against time. And I want to continue to reiterate that. But if we are working within the confines of the 6 days that we have, they'll get it done. They've done the prep work to move there. I just don't know specifically where they are. But I think the last barrier is, of course, convening the IEP teams, and then, of course, they're going to have to do those meetings virtually with the parents, because parents are also a part of the IEP team.
Okay.
But they are very committed to making sure that they meet the tenets of the IEP.
Okay,
And
thank you.
then Zoom has breakout sessions too. And so I do know that some of these special ed teachers did do breakout sessions with their students on Zoom, separating them from the class. Because my husband teaches special ed. Okay, so the question, the motion on the floor, or the recommendation on the floor, the motion, is August 24th, going 100% virtual. I'll call for the question. All in favor, let me hear you say aye. Aye. So it's Mr. Johnson and myself, all opposed. Let me hear you say the same.
Aye.
And Mr. Bailey and Ms. Coggan opposed. Okay, so it's a tie for that motion. So in the event of tie by law, and it's a tie because we're a 4-member board, runoff is next week, but in the event for a tie, because this still has to do with the operation and the date staying the same, by law, you can actually propose what it is that you want to do and overrule the tie. Or we can have the second option, and that's the law, as the executive operational officer of the school district. With a tie, you have the right to say what it is that we're going to do without a vote needed. Or we can do a second motion.
So, the second recommendation would be that I recommend that we adjust the calendar to a start date of September 8th, and study the data and adjust the model as necessary, perhaps convening again on August the 31st to share what information we have. That's a Monday for a board meeting to share data and make a determination from there.
Okay, so just to be clear, the new recommendation is to move the calendar date to September 8th.
Yes.
Then you want to study the data and look at August 31st to determine what instruction model will be used.
Correct, following the plan that we have implemented, yes.
Following the plan that you have implemented. So when you say follow the plan,
Just what we're doing right now. We've got our plan, and it gives us the guidelines for transmission. We're gonna look at the data and then come back and make a determination from there.
so with that recommendation, you're saying September 8th, the 3 choices are still in place.
Yes,
August 31st, look at it. And on August 31st, determine what will be the instructional model based on the data and the plan that you're following.
yeah.
Okay. You heard the new recommendation. Is there a motion?
So moved.
Is there a second? Having no second, that motion failed.
I have a question. Is it appropriate?
Is the question,
Clarity.
yeah, you can clarify. You can ask a question of clarity.
You're saying the 31st, because I didn't catch that. We'll do what on the 31st?
She had said to look at it again on the 31st, look at the data and the guidelines on the 31st, and then on the 31st, determine the instructional model.
Then we'll decide what date we open school and in what format?
No, the date of opening would be September 8th. We would look at, so the new motion was to look at September 8th, and then look at September 8th as the start date, keeping the 3 choices right now with the September 8th start date. And then on August 31st, look at the data and the point and everything they're looking at, and then determine if you need to change it from in person at that point.
Okay, we decide what direction we're going out of the option.
Yes.
Okay,
And I-
understood.
And I made the motion, or so moved the motion forward. We are now waiting on a second.
No, it failed.
Oh,
Unless
I thought
somebody-
he wanted clarity before he voted.
Yeah, I was under the impression that because there is a delay,
Oh.
that he had clarity, so I'm sorry, but yeah, I don't know if we need to retake or ask for the motion, a second again.
Is there a second on the motion?
Second.
Okay, Mr. Johnson is now seconding the motion. I'll call for the vote or discussion. Is there any discussion? Okay,
Let me.
Go ahead.
Another time for clarity, if I may. The motion is saying that we're gonna change the date to the 8th September. And on the 31st, we're gonna review it to determine what direction we'll go out of the option plans we have now.
yes. That's,
Now, another question, is there enough time to react in 1 week's time to decide that? Should we or could we establish an earlier date to review information? Or is that an option to establish an earlier date?
An earlier date, okay, I didn't hear what you said.
I guess we would just have to do a new motion if that were the case.
Hey, Madam Chair, I have a comment if we've answered his question. I just know from the people that I've talked about, or talked to, I should say, and as my son said yesterday, I wish somebody would just make a decision so we know what's going to go. I don't like the idea of coming back here on the 31st and debating on, deciding on or finding out our instructional choice. I think we need to make a decision. The vote to the motion to go completely virtual failed. So I would rather just go ahead and plan what we're doing now and offer the choice for those that want to do it and do virtual. But if you tell me we're coming back here on the 31st and there's still a possibility we're going to go all virtual, my question is, in March when we shut down, the governor issued an executive order. Truly, would we have shut down them without the direction from the governor and the state? Maybe not. And so, in my
Probably not a
opinion-
fair question, though, because we didn't know the information back then.
Well,
so-
exactly. But my point being.
but they've
is-
always given local control.
Yeah.
We've,
And
as a board, we have always put that yearly in our guidance and in our things that we send to the state. We fight for local
You're
control.
absolutely right, but that's why I'm advocating for choice, for those people that cannot come in. So basically what I'm telling you is I'm not going to be able to support this motion, knowing the people that I've talked to, representing my district, me personally, however you want to look at it, I just can't support that. I want to have the option to be virtual or have the kids go go in person. Just because I know the virtual's not, we don't have the infrastructure. There's too many ifs to that. Just like there's too many ifs for being in person. But just give choice. That's my point.
So you are resolute on, even if we were to move the date to the 8th
Study the
and work
data.
towards that, I know we're working with the county commissioners and trying to talk about,
You still only give parents, like the way y'all try to do this, you still only give parents 1, 2, 3, 4, 5, literally.
Right.
That's
One-
why I want us to make a decision.
You
so that we
literally
know.
only give parents one, well, that's why I said before we went into
Right.
recess that it needed to be stated a different way. I said that
Yeah.
plain as day. I
Right.
said that plain
So-
as day
We
for a
heard you.
reason.
Yeah.
But you guys are about to give people 7 days.
Look.
7 days.
That's what I'm saying,
If
let's
you
decide
cannot go
today.
face to
All right,
face to
Ma-
have to make plans.
Madam Chair, we are preparing people to do that in a day's notice. So I feel like 7 days is being gracious at best we can. Even Mr. Johnson, I know you had concern too.
But Mr. Bailey,
But if we have, like currently, if we were to start tomorrow, we know that as soon as we can go in person, we want to go in person. Well, as soon as something happens that dictates that we have to stop again, we're not going to give people 7 days. So I feel like I'm kind of with Ms. Coggin. We need to make a decision and then work towards the best thing we can do to making that decision work.
I agree with you guys that a decision needs to be made. Here is where I have an issue. We just heard an entire presentation about why the district needs to go virtual.
But
In
you
your
heard
speech,
you heard my recommendations. so
in
you
your
voted it
speech,
down.
you said plain as day, we need to, the superintendent in her entire speech to open this meeting up said plain as day, we need to go virtual. That was the recommendation from the entire team, the people that we rely on every month to bring us recommendation. The experts that I've heard you guys use the language, they're the experts. They're going to bring us the recommendation. The recommendation that the experts brought you guys that they have been working on said we need to be virtual. But y'all shot down that recommendation.
Madam Chair, with all due
Let
respect.
me- Mr. Bailey, I have the
But that motion is
floor.
not on the floor.
The motion was on the floor.
No, but
and I
we're-
have
we're
the floor.
discussing this motion, though, now.
Right, but I'm going back and I'm proving that motion was on the floor.
But we've
That
already
motion-
passed it.
But you're just saying in your motion now, you said we need a decision. A recommendation was made for a decision and you shot it down.
Which
It
is
did
our
not
job.
pass.
Right.
It did not pass. But, so what I'm saying is this new recommendation that y'all are trying to make, it only gives people 7 days. I also said in my dialogue, I said at the beginning, I said that from July 7th, our language was always, this may change. But people did not hear that. So if people didn't hear that then, they certainly not going to hear that now.
Well, all we can do, though, is make a motion and vote on those motions based on how we represent our districts and how we represent the entire community. We are trying to work towards a solution that is best
But the
for everyone. We're not,
The experts that we rely on monthly.
Ms. Henderson-Baker,
to bring- Ms. Coggan, I have the floor. Let me finish. The experts that we rely on monthly to bring us information just brought information and made a recommendation.
yes, you're right.
May I speak?
Yes.
The experts also told us that we're not sure if we can provide the infrastructure for an all-virtual platform.
So we are in a
Dr.
conundrum.
Thomas and
We're
Dr.
going to try.
Fayol
We are going to try.
just said, she just used the numbers. And she said, given that what she's going to present on Tuesday, we will have the capability.
Well, yeah, that is what may be presented, but we don't know in
We don't know if it
functionality
will
yet.
work. And that's my point, is to allow for choice, because we don't know what the plan is for sanitizing, for cleaning.
You're
We
right.
haven't heard it.
If you don't offer choice to our district, here's what you're saying, that you're not compassionate towards our district. And I know you're compassionate for all the kids. I'm not trying to paint you in that picture. You don't want anybody to get hurt, and I don't either. But I think that if we leave that decision to our parents, because the other alternative for them is that their kid doesn't get educated the way they want to get educated. And the option that we're offering the entire community is not equitable anymore. And I know you're about equity. So I feel like the most equitable decision for our entire community is to give them a choice. They don't have to take the choice.
And let me just say, the superintendent did not have to bring that to our vote.
That's true.
She can make the choice on the type of instruction. She doesn't have to ask us. So if that's the case, and you just want your motion, but that's not the motion on the floor,
Right.
it's tied in with the determination of which way we're going to go, that's fine. I mean, we can vote strictly on the calendar, but the first motion to go all virtual, the first motion, it didn't pass.
Right.
So it is strictly, and I want the public to understand this too, it is strictly the superintendent's decision on what kind of instructional platform we will have. So we don't need to be brought back in here on the 31st and asked to decide what's best. You make that decision. But you've asked for our opinion, we've
Yeah.
given our opinion, end of story. So I'm ready to vote whenever you are.
That is a good point, because then, I mean, it's not, while it is your decision,
I said
you know we
that.
got your back, and like, we're not gonna go out there and go, well, she said, and you gotta take it up with her. I'm still gonna represent my
people will
district.
say that.
Yeah, I
Doesn't
know,
mean they will.
but, and
But that's
look,
fine.
we're also gonna get tagged as we don't care about teachers and kids, when that's the
Right.
last thing on the planet.
It's
I mean,
all bad, nothing good.
I do hope, yeah, and that I hope that people do understand and see that we're all wrestling with this at all the levels. We're trying to wrestle with what's the most equitable decision and safe and practical for our people. We're all really on the same page with that. It's just the differences of how we get there. And I don't know that we're going to agree completely on it, and this is a difficulty with having a 4-person board right now.
I do agree with that. I do agree that we are not completely going to agree with that. I said, as the board chair, it's my job to tell what can be done by law, by policy, what the policy state. I did say that the motion failed, so the superintendent, as the executive officer, you can just go ahead and say what needs to be done and not even need us in this process. We do have a motion currently on the floor, as of now, that we do need to take a vote on. But I did point out all of those points, and I do think this is not going to be something that all of us agree on. When you guys talk about what's unknown is the infrastructure and the technology, really everything is unknown, really.
Yes.
Even
That's
if
true.
we open the doors, we still don't know what's going to happen because we see what we do know. Now, what we do know that none of us can argue with is, we do know that when doors are open in school buildings, people are testing positive and people are going out. Now, we can't argue with it.
Just like we can't argue that with any other place of employment and
Absolutely.
essential places of business and.
Absolutely,
Okay.
absolutely. But
Yes.
that's what we do know. Dr. Thomas?
If I could make a point of clarification, and I'm just referencing the stakeholder survey that was sent out that everyone had an opportunity to participate in. The question was posed, do you or your student have access to technology? There were 9% of the people who responded to the survey that said that they did not have technology and may have, need a device. And we certainly have a plan in place to provide a device to that 9% and those who have, will request a device. The next question was posed, do you or your student have internet access? There was only 4% that indicated they did not have internet access. And I'm sharing this not to negate the people that don't have internet access, but I want to put it into perspective from the people, from the stakeholders that completed the survey, that it is 4% that indicated they did not have access versus 96% that said that they did. Even though we are still working to make sure that the access and the data capacity is appropriate for the families in which we serve. But I just want to give some context to what we are
But
talking
that's
about.
where I disagree with that survey. That was done back in June, and it was based on, I answered, yes, I have internet access, and yes, I have access to technology. But now seeing the schedule based on that, and knowing my children are both gonna have to be on there, I think you've got to retake that survey, because in my situation, I would have changed my answers had I known that process.
Okay, and then, and I respectfully understand that, and just as I mentioned earlier, anyone that's having those type of
Right.
household concerns, Dr. Fayal has worked with his team and the local providers, well, not necessarily local, but the internet providers, to see what we can do, because we do have the option to extend the data that's available that may eliminate that concern that you're having, as well as see which type of hotspot would be more appropriate, where they may have access now using a different hotspot device versus what they had before. So thank you for sharing that. But again, I just want to point out that, things are a little different from what they were, a few months
That's my
ago.
point, too.
And,
Yes, exactly.
right. And we're saying, I
Yes,
guess
we're
we're saying the same
thing.
thing, but I just
Yes.
want to share that we are working on
appreciate
it, and we do have other options and resources in place now than we had, back in the spring. But thank you.
Thank you.
Okay, so the motion on the floor as of now is to start the school year on September 8th with the 3 options still in place of face-to-face, option 2, virtual school-based, option 3, virtual self-paced. To look back at the information, the superintendent and her team will look back at the information on August 31st, and then from there, decide if the 3 options will continue, or then from there, decide what will be the instructional option or options.
Right.
Okay, I'll call for the vote. All in favor, let me hear you say yes.
Yes.
Aye.
All opposed, let me hear you say yes, the same. Yes.
Yes.
Still 2-2. Ms. Fury, once again, as the executive operational person over the school district, the motion has failed. As the executive operational person over the school district with a tie, you have the authority, without a recommendation needing a vote, to tell what the operational structure will be.
Right. And so regardless if it was a tie or not, my recommendations both have not made it out of the committee. So I think based upon our current plan and the information that we presented today, that we'll move forward because you guys are struggling to give me feedback and guidance on a direct, you can't agree on it. That's the problem. People, we can't agree. So I will make the decision to move forward with going to a virtual option and studying the data until such time that we make a different choice. And so that's where I'm headed.
So just to
This
clarify-
needs no recommendation.
It's not a recommendation.
Let me-
Clarification.
I'm gonna-
Start school on August 24th?
Because that did not pass.
That didn't pass. The calendar didn't pass.
It doesn't have to.
But if we adjust the
Well,
calendar.
I have to adjust I would have to adjust the calendar because you still have to train all the people. So
Right, so that's my question
Yeah,
is.
I would have to bring that
Right
back.
now, what you're saying is that we will start virtually.
Right.
On
August 24th.
Yeah.
So is that what we're going to stay with?
So no. So in order to make that happen, we've got to adjust the calendar for a start date of September the 8th. So that my team has the ability to be able to train the folks who need to, the whole staff that needs to be trained to be virtual. So that would be a recommendation for you to vote on, but the model itself is virtual.
So let me clarify as chair, please. Let me clarify. The superintendent is going to use, and I don't know the policy number.
AFC.
AFC, thank you for having that on hand. The policy is AFC, which does give her the authority to make the decision on what the instructional model of the school district will be in an emergency situation. Emergency can include weather, and it does say in there health and safety, when health and safety risk or when they feel like the health and safety, I don't know the exact wording,
That's
it's health
correct.
and safety of the students and staff are jeopardized. So that's policy AFC. So the instructional model will be virtual. That needs no vote at all. She is asking now to go on the floor the recommendation for a calendar start date of September 8th. Is there a motion to move the calendar to September 8th?
So moved.
Is there a second? I'll second.
All right, this is for discussion? For clarity? For clarity.
After the second it is. So I'm seconding it.
okay.
The floor is now open for discussion.
All right.
Mr. Bailey?
The only motion on the floor right now is moving the date to September 8th. That's all I'm voting for right now.
Yes.
Okay?
Okay. The instructional model has been chosen just to,
Well, you keep saying that, but that's not the motion.
no,
So I
that's
wanna
not,
be-
I'm
Then
just
don't say
making
it right now,
clear.
let's wait.
Okay, I'll clear it up for the people afterwards then. I just want to make sure the people following are following. Even though I just said all that, I know it's a lot to take in, so, okay.
So just repeat the motion if you
The
don't.
motion on the floor, the only thing on the floor that the board members are getting ready to vote for is the September, to move the current start date from August 24th to September 8th. That is all that we are about to vote for.
And shortening the student days to 170, is that
Correct.
correct?
That's
Okay.
correct.
And teachers would remain, other
Coming
staff
in.
would remain the same.
Yeah.
All right.
Teachers, staff,
Report as, right now.
report as normal.
Yep,
Your-
August 14th. We'll put
Te-
out a new calendar.
Teachers still at 180 days.
90.
190 days. Y'all about to start sending me text messages. 190 days. The only days, as Ms. Coggan has identified, that will be, the only people that will be affected by days is the students in terms of instructional days. Okay, just for clarity for everybody. Again, the motion on the floor is only about moving the calendar today for August 24th to September 8th. It's been moved, it's been second. I'm gonna call for the question. All in favor, let me hear you say aye.
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 Is that 3? All opposed? Abstain? Were you an aye, Abigail? I didn't hear you. Oh, okay. I said 3, okay. So the calendar moves September 8th, the start date for students,
Correct.
let me say that again. For students, the start date will be September 8th. That was a 4-0
Correct.
vote.
That's the way I understand it.
Okay, so let me explain again for clarity what just happened. The motion for the instructional model failed from the board. By law, using policy AFC, right?
Yes.
AFC, want to say it in order in case somebody want to look it up. Using policy AFC, the superintendent, as the executive officer of the school district, operational officer, has the right to decide what the instructional model will be in situations where the health and safety of students and staff is in jeopardy. She has chosen to use that policy and to use her executive authority and make this school district all virtual. The start date is what the board voted on, since the board couldn't decide on the instructional model. The start date will be September 8th for students. So again, now if y'all want to tweet, Facebook, everything, it is September 8th start for students. The instructional model will be virtual. Okay? Woo. 12:14. Other matters of interest.
Yes, Madam Chair?
Yes.
And I know we're all ready to go. But and this may be my ignorance, but I was under the impression and led to believe that a 2-2 vote would, the motion would not pass. And I was not aware of this policy AFC, and that's certainly on me, I guess, to learn that. I've never been taught the AFC policy. I couldn't even find it. While I trust you as my board chair, I would just ask if someone could follow up with me and show me that in writing so that I can explain to my constituents that I went into this meeting understanding and being told and that a 2-2 would not pass. And instead, what happened was a 2-2, and somebody else got to make the decision. And I was not aware of that. And I want to go on record as saying that I was misled in how that this Robert's Rules of Order would take place. And again, that is completely my responsibility, but I was misled, and I just want that to be, I need my constituents to know that something happened in this meeting that I was not prepared for.
Okay, that's fine, Mr. Bailey. I have no problem with getting that from Mr. Hartley.
It's on our board, it's on our page, it's policy AFC. One thing that you need to point out is that it gives the superintendent the authorization to take action to close one or more of the system's schools if conditions exist that may threaten the health and safety of students and personnel. And after consultation with Mr. Hartley, said you're really not even closing the schools, you're just changing the model of instruction. And so that's what the policy said. So, and y'all did not vote on the plan either, the original plan. So it was just a presentation and to provide you with information. So there's certainly not an intent to mislead at all.
I do, and I appreciate you saying that, but the agenda item as it reads is a requested board action
Yeah.
relative to the
Revisit the
revision
plan.
of the reopening plan. If I
But-
never voted on an opening plan to begin with, I would
Yeah.
not vote for a revision.
Yeah.
So that's where,
Yeah.
again, and I didn't vote for a revision.
Yeah.
But yet that was the calendar item, and when
Right.
I inquired about, the agenda item, when I inquired about the agenda item and what would happen if a vote was 2-2, I was told that it would not pass.
It would fail. It did.
Right,
Yeah.
but I was not told that because it will fail, we have now another option. I was not aware of that option. And I feel like there was plenty of opportunity for someone to tell me that.
Yeah.
And they were not. So
Yeah.
I'm not calling foul.
Yeah.
I'm just
No, it
saying,
wasn't.
it's certainly on me to
It
know
wasn't.
my
And
board policy.
you put me in a position to have to operate the school system.
So-
And if everybody can't decide, somebody
I
has to
do
step up
understand
and
that,
do it.
but-
And so,
That's it.
and for
I would've done
clarity,
it
let me
out
say
of the-
too, let me say something for clarity. In many of my dialogue, in some of my responses on Facebook, and in some of the things that we did, even the community videos where various community organizations asked, like whose responsibility or what can happen. I mean, you and I didn't have that conversation, but I said that the superintendent actually by law does not need us. I've said that plenty of time, that the recommendation, she actually has the authority to do it on her own.
Yeah, and look, and I am, now that this meeting is about to adjourn, I am fully supportive of my superintendent.
Yeah.
And I will convince my district that she still is thinking about every district and every person in our district. And, we're going to lean heavily on Dr. Thomas and Dr. File to make sure that our district is covered with what our needs are. So I have fully support my superintendent and this team. It just didn't go my way today.
Okay? Any other matters of interest? Okay, having none, may I have a motion to adjourn?
So move.
Is there a second?
Second.
Okay. It's been moved and second. All in favor?
Aye.
Aye. Y'all don't want to adjourn?
What happens next? This will be fun.
I've had enough.
All
I've had enough
opposed?
of the fun today.
I'll abstain. You have enough to carry your motion.
Okay, abstain. All right. Meeting adjourned, 12:19.